the meeting of the Central Health Executive Committee. Public communications. We will receive public communication to the executive. Registered with Central Health via the Yersinia, did hold on, we need the person.
Yes, Mr. Chair. Sorry, I'm having technical difficulties. We have 7 people signed up to speak for board managers.
Great. Then are you going to announce them and you can go sit at the.
Yeah, you can sit over here. Okay, I will now read the guidelines for this meeting's public communication. When called upon to speak, please introduce yourself by name before beginning your comments. Also, if your comments will focus on a specific item or issue on the agenda, please indicate the full item number. Each speaker will be limited to 3 minutes. I will be timing each speaker and will announce when the speaker has reached their limit. To ensure the efficiency of the meeting, once we have let the speakers know they've reached their limit, we will allow 30 more seconds to wrap up their comments before they are muted. Due to the restrictions of the Open Meetings Act, the board may be restricted in discussing any items that are not listed on the agenda for this meeting. The board may choose to set aside any new issues for discussion at a future meeting. We received 7 submissions for public comment. And at this time, I will call on our first speaker, Francisco Ortega.
Thank you. My name is Francisco Ortega. I go by Frank. I'm sorry, but I don't have the item number here though, but it's in reference to a budget. And it's a question. This was published by the Austin American Statesman that all funding for, the administrative budget figures includes money for a performance audit that was required by Travis County Commissioners in August. The question is, will CH put into the budget funds to pay for the forensic asking for? That's the first question. My second question would be, the article does not explain how they will balance the budget, followed by all funding for Dell Medical will go through CCC. As a layman that doesn't do what you all do, I don't know what CCC is and why it's in existence. Thank you.
Thank you, Mr. Ortega. Mike, can you either answer or have staff answer, or if it's something that needs to be taken offline, we can do that?
Certainly answer it.
Sounds good. Sounds good.
Thank you.
Thank you, Mr. Ortega.
I will now call on our next
Good evening.
Hi.
My name is Larry Wallace Sr. I'm not the doctor, even though I get confused quite a bit. I'm here to speak on item number 2, the budget, and to ask for your support for the Black Men's Health Clinic. We launched about a year ago, and we believe we line up perfectly with your health equity area around Black men and needing to have more Black men that are accessing healthcare. We believe we have a solution to that. We're positioned to do it. Expertise, the passion, and the get it done. And so we're asking for your support. And what specifically we're asking for you to do is support 5 positions for us, 5 FTEs. And those are really in the area of outreach and management of patient services. And so I think that total comes to about 290 for those 5 positions. Community care. Site 2 days a week. Trinity.
Good afternoon, Mr. Chair and Board of Managers. I'm Sharonda Robinson, and I am the CEO of the Black Leaders Collective. And I'm here today to speak in support of an item on your agenda, item number 2, for funding for the Black Male Health Clinic. For those of you who know me, in my other day job, I get to work with community and to bring people together and to do outreach to make sure that folks understand what the services are that are available, and sometimes also what the issues and needs are. And the items that are asking, that the Black Male Health Clinic is asking for funding, are critical to its success, particularly around the community health workers and the community ambassadors, the people who would be on the ground making sure that we reach community, Black men, men of color, who don't typically have a focus by our healthcare systems. And so there's been yeoman's work that has been done by, led by, we call him Dr. Wallace, by Larry Wallace and a team of folks to put the clinic on the ground. And so this is about how do we fertilize and ensure the health of the institution that is designed to do what our mission is here at Central Health, is to improve outcomes. And so our Public Health Committee has been meeting and working together on multiple issues over 2 years. We've identified the Black Male Health Clinic as a priority for Black people in this community. And this comes from over 100 leaders throughout the community. And we are in full support. And we honestly think you should be doing more. And we want you to do more, and we want to partner with you. We've been working with your CEO, Mike Giesling, several years as well, to ensure that equity is embedded, that it's intentional, it's purposeful. And we see this initiative to more fully fund the Black Male Health Clinic as something that is integral to the mission of Central Health. Black men, 3 of them, for your support.
Lofton.
I say I am Mike Giesland. I just really want to say I'm very happy to be here today. This has been a long time coming. I have had the pleasure of working with Mr. Larry Wallace for many, many years. Even when he was at Central Health, I really enjoyed working with him because I remember day one when I really began to connect with Mr. Wallace and asked him if he would assist in bringing a MAP office over to the African American Youth Resource Center and Central Health. Really supported us on that initiative then. And today I'm coming back to ask not just Mr. Wallace, but the whole board, Mr. Giesland, the African American men in Travis County, the city of Austin. They really need your support. I think we all can say that the COVID pandemic unearthed a lot of things. We know that there are a lot of needs out there, and these needs cannot be really, really fully addressed without the support of Central Health. We really need Central Health to come. I think item 2, which is what I'm referring to, I think based off of the needs that we have in our community, it's really a strong request from the community. I've talked to a number of individuals in our community. You take a look at the number of men that are coming in. I think we had over 700 plus men to complete a survey to talk about the needs and the disparities in the healthcare in our community. And I think we all know it. Even the city of Austin passed a resolution about a year or so ago talking about the disparities in the healthcare. And I would like for them to see today that there's not a disparity, that Central Health is going to step up and help address these systemic issues. The Black Men's Health Clinic, everything that Mr. Wallace is doing, along with many other boots on the ground in the community, we really could use the support. And I'm here today to just ask for that. The request for the staffing, some $290,000 or $300,000, is a small price ask for the return on the investment. I think the return on the investment, and you can rest assured, the Harvest Foundation, we're going to be there to make sure that you all see the return. And so we're calling on you all today to help the community out. The men in this community are taxpayers. We know that they have not been receiving the health care that they so desire. And so we're calling on you all today to help make this investment, not just investment of money, but the investment to save the men who have worked tirelessly to help pay taxes. So anyway, we need your help. And so it's my hope that you all will come to the table, come to the aid of the men in the community. Thank you.
Thank you very much, Mr. Lofton.
Next, we have Bill Wallace.
Councilperson, honorable board, distinguished guests, my name is Bill Wallace, and I'm the founder and director of Tomas Promise Foundation, a local 501c3. And today I'm here to discuss item number 2 in support of the Black Men's Health Clinic, and specifically to ask that Central Health continue providing resources in the amount of 5 positions to be funded. I think these positions are mostly administrative and outreach, maybe some grant writing. And as a user experience, as a 41-year-old Black man, I can tell you that the outcomes and disparities in health for Black men are not good, as you all know. Also, our trust. My constituents, Black men in Austin, probably don't trust the traditional forms of outreach for medical. And Mr. Wallace has created a space, a safe space that can be trusted. And my word, the word and integrity of my organization and being a born and raised Austinite, will leverage everything in my power to make sure that Black men know that they have a space, a safe space to have positive outcomes. And we thank Central Health in advance for investing this small amount into the equity of Black men in their medical outcomes. Thank you very much.
Thank you, sir.
Up next, we have Michael Cochran.
I wasn't speaking, ma'am.
Oh, then next we have Michael Ward Jr.
Good afternoon, ladies and gentlemen.
Good afternoon.
I'm Michael Ward Jr. I am a father, I'm a husband, I'm a community leader. Not an Austinite, but people tell me that I do a lot for Austin, so I think I'm an honorary Austinite. And I do sit on several different boards. I'm on the board for the UT Engineering Science School. I'm in the board for the Texas Science and State Fair. I'm on the board for member of the IT caucus for the Texas House. I run a nonprofit, so I'm a business owner. And I'm very indebted to the work that goes on here in Austin, not just for myself, but also for the communities that we serve. Right now, we have over 500 individuals in our program trying to get inside the tech industry. We have over 50 different partners that are all supporting and diversifying the tech industry through non-traditional pathways. And here today, I come to not just myself as a Black man, but for all of the Black men and people of color inside our program that also leverage the resources of the community, such as the Black Mental Clinic. So I'm here today to ask for additional funding that would allow for the hiring of 5 additional staff for the Black Mental Clinic. But I also ask for your commitment to get the job done, right? We know that Black men have about 10 years less in life expectancy when it comes down to their Caucasian counterparts. We know that Black men or Black people in general do not really trust the traditional methods because when they go into a healthcare facility, they don't see themselves. My wife and I, we actually decided to do a home birth because we did not trust the healthcare system. So now I have a 6-month-old baby girl home because my wife decided to do a whole new journey in the comfort of our home with her doula, her midwife, people who look like her because she didn't trust the healthcare system. And that's what we're trying to do here for Black Mental Clinic. Like we want an alternative option that really allows us to lean in into what we want to do. And we want the support of Central Health so that at the end of the year, we can all say, good job with what we've done. Versus, well, we gave you this, well, you did that, well, you didn't do a good job. No. Like, let's all come together. Let's outline the objectives. Let's really put together the funding, the partnership, the resources that are needed so we can have more fathers, right? So we can have more Black men that truly support. And then now their children want to be doctors, right? Their children want to be engaged and actually be a part of a true healthcare system that we know is supported, regardless of your zip code, regardless of what part of town you live, or regardless of what skin color you have. So I please urge you to support the Black Mental Clinic and all the great people that have came here before, talking data, stating facts, and use their own testimonies as well as a value to say, let's do this. And that's it. Thank you.
Thank you very much, Mr. Ward.
Up next, we have Gregory Harrington.
Thank you for that measure of cleanliness. I appreciate that. COVID is still real. COVID is absolutely still real. To the board here, I just want to take you back to August 2020, right in the midst of this thing called COVID. I think y'all heard about that, right? Y'all heard about that. Yeah, I was in Vegas. Yeah, found out I got a blood clot. All up in this side. First time ever being hospitalized for myself.
One would assume that me working at Dell, have good insurance policy, would allow me to get access to all of what I need. Yes, that is absolutely true. I do. However, the most visits I go to is my dentist, because I want my teeth to be clean. But guess what happened at the dentist? The dentist checks my blood pressure. Found out that I have high blood pressure. As a result of blood pressure, I have vertigo. I don't know, has anybody in this room had vertigo? The room just freaking spins and does not stop. This is me with fully employed great insurance at Dell. My name is Gregory Harrington. I'm the brother of Alpha Phi Alpha Fraternity Incorporated. I'm the president, a leader of a whole lot of great men. I don't know if y'all heard of two of them. I'll give you just two names, Dr. Martin Luther King Jr., Thurgood Marshall. Yes, great men, right? Yep. I lead those guys here in Austin, Texas. Some of the ones that might be on some names of the buildings that you know of, Delco Center, so Wilhelmina and Exalton Delco, Charles Aikens High School, Alpha Men. I'm the president of these guys. But even in the midst of us having high education, we still have a lot of guys who just simply don't check our health. We need every single component of ease to get great access to health. If you have a black male clinic, the name alone will encourage people to simply go. Let's call it what it is. It's great marketing. But if you have the services that support it, we dealing with some stuff that you all may have heard about just because cameras are now on. It's already been happening, this thing called oppression. I don't know if y'all heard about that. That's a real thing in the black man world. And what if you have an outlet to simply even talk about your issues? That in itself will help some people reduce their high blood pressure. Some will cause some of the emotional stress to be reduced because you simply have an outlet for black men. These are real things. I recently was talking to who will soon be my fraternity brothers and who also happens to be my pastor's new wife. They got engaged. And about 2 weeks ago, she tells me and my 47-year-old self, the new age for getting a colonoscopy is 45. I'm like, I'm 2 years past it. I thought it was 50. You're welcome for anybody that didn't know that. Welcome to a colonoscopy. These are real things that we simply don't know. I'm an engineer, man. And now I'm in marketing it there. So at the end of the day, if I have access to all this, what about the guys who may not be as fortunate as me to have access to great insurance, access to a doctor that I can call? I literally have been with my same doctor for 25 years. I got his cell phone number. He don't like me to use it, but when it's show time for him to refill my blood pressure medicine, guess what? He's gonna answer. So at the end of the day, support the need. And I'm not even just saying just support the 5. Support the idea of a black male clinic. Do you have one? I don't know of another one. Just support the idea. The 5 heads is great. That's just a start. But simply support the concept of a need because there absolutely is one. Thank you so much. I'm happy to answer whatever questions you may have.
Thank you very much, sir.
Next up, we have Paulo Connolly.
Hi, y'all. I'm João Paulo Connolly. I'm the organizing director at the Austin Justice Coalition. I'm going to keep my remarks fairly short, but I'm just here today to voice my support and solidarity for this request from the community. I don't spend all my time focused on health and healthcare access, but we recognize how important this request is to the community and the folks we work with. And so we couldn't miss this opportunity to come here and voice our support for it. The Black Men's Health Clinic needs more funding. It needs more support. It needs funding specifically for these 5 positions. Outreach in the community is extremely important. We also think it's very important to do the truth-telling piece constantly and remember the role that racism has played historically and continues to play in our healthcare system. And this cannot be addressed simply through equality. We need proactive equity. We need policies that address and repair the harm that has been caused over this history of this nation. And so we think this is an important step today, and I'm just here to voice my support and solidarity for this request. Thank you.
Thank you very much, sir.
And lastly, we have Manager Cynthia Valadez.
Probably going to just be reappointed. But for those newer members or new members, I think it's important for us to take that into consideration. Aside from the fact that they'll be new and learning how those boards operate, I think that we need to take into consideration the demographics and try and close those gaps in representation as we try and achieve our demographic populations from the top down.
And if I understand you correctly, and it's not just, for example, for the medical access population, which we have dashboards that disaggregate that data by gender, race, and ethnicity. It's also the entities to which the appointment is occurring.
Correct.
That you see those patient breakdowns, because those are going to differ from.
I get it, from population.
Am I
yes,
tracking you
you're exactly right.
All right, got it.
Okay, and because they're to be advocates for their members, but also to all Travis County residents. Okay, as we try and get them hooked up to services.
Thank you, Manager Valadez. Any additional questions? Hearing and seeing none, I will go to agenda item number 3. Discuss and take appropriate action on the reappointment of Dr. Guadalupe Zamora and Mr. Hal Katz to the Integral Care Board of Trustees. Brianna?
Mr. Hal Katz has served as one of Central Health's appointees to the Integral Care Board since 2010, and Dr. Guadalupe Zamora has served since 2014. They are both seeking reappointment for an additional 2-year term. Their current term ends September 30th, 2022.
Thank you, Brianna. Do I have a motion from Manager Valadez?
Yes, thank you. I move that the committee recommend that the board approve the reappointment of Dr. Guadalupe Zamora and Mr. Hal Katz to the Integral Care Board of Trustees for another 2-year term.
Manager?
I second that.
I have a motion from Manager Valadez. I have a second from Manager Greenberg. Any further discussion? Hearing none. All in favor?
Aye.
Any opposed? Any abstaining? Motion carries. Thank you very much. Congratulations.
Dr. Chair, may I say one thing?
You sure can, Dr. Zamora.
Just got a text from Chair Katz thanking the board for the reappointment. He was on the Zoom meeting, but had to transition to another meeting, but he wanted to apologize for not being here. But I want to thank the board, and Chair Katz wants to thank you all for reappointing us. Thank you.
Thank you for your service. We really appreciate it. We appreciate the fact that you're representing us in one of the agencies that deals with behavioral health, and you do an excellent job. And that integration between medicine and behavioral health is so important these days. And so we really appreciate that. Manager Valadez, and then Manager Matwani.
I just want to say, I want to thank you, Dr. Zamora, and I want to thank Mr. Katz and the Integral Care Board. My daughter has been a member of the old MHMR, which is what you have transitioned into, Integral Care. She's been a patient forever, most of her life. And I want to tell you that there are great things that can be achieved when we have good, compassionate staff working with our special needs or physically or intellectually or behaviorally challenged, mentally challenged population. And y'all are godsends to families and parents who have family members that are in that population. That's all I can say.
Thank you.
I tell the staff that all the time. They are the gold standard of what behavioral health should be done in the United States.
Thank you, Manager Valadez. And I concur with Manager Valadez to thank Mr. Katz for his excellent service and time that he has spent on the Integral Care Board, providing guidance and leadership. We surely appreciate it. Manager Matwani.
No, I withdraw. I had a point of clarification and I solved it myself. Thank you, Chair. Forgive me. And certainly echo your sentiments and Manager Valadez.
Thank you, Manager Matwani. Manager Jones.
Thank you, Dr. Zamora and Mr. Katz, for your service and continued service. In light of the question that Manager Valadez asked earlier about appointments, is it possible we could get a profile of the demographics of the boards for which we provide appointments for, such as integral care, community care, and other boards that we think it would be helpful at the time of voting to be able to have that reflective. So our request that we do that at our next appointments and henceforth.
And that request is of the demographics of the board of directors of the organization.
Well, it'd be helpful if we could have the board of directors. That's what I'm asking for. But side by side, if we could also have the reflection of the population that serves also, that would be helpful to see as well. So
thank you very much. Appreciate that. Any further questions? Hearing none, I will go to agenda item number 4, which is to confirm the next regular executive committee meeting date, time, and location. Managers, our next Central Health Executive Committee meeting is tentatively scheduled for Wednesday, October the 26th, 2022 at 5 p.m. at Central Health Administrative Office, 1111 East Cesar Chavez Street, Austin, Texas, 78702. At this time, I'm ready to accept a motion for adjournment. Manager Valadez.
I'll second. I think I'm seconding Manager Greenberg's.
Manager Greenberg.
Move adjournment.
Second. I have a motion from Manager Greenberg. I have a second from Manager Valadez. Any further discussion? All in favor?
Aye.
Any opposed? We are adjourned. Thank you very much, members. We will go directly into the board meeting. And let's see. 1 second, please. Okay. Good evening again. Today is September the 7th, and it is 5:49 p.m. As a quorum of the board is in attendance, I would like to call to order the meeting of the Central Health Board of Managers. The first item of business will be the consent agenda. Consent agenda C1, approve the minutes of the Central Health Board of Managers, August 24th, 2022 meeting. C2, receive and ratify Central Health investments for August 2022. And C3, approve the reappointment of Dr. Guadalupe Zamora and Mr. Hal Katz to the Integral Care Board of Trustees as recommended by the Executive Committee. Do I have a motion? Manager Valadez?
I move that we approve, that the board approve the consent agenda items C1 through C3.
Do I have a second? Manager Matwani?
I second.
I have a motion by Manager Valadez. I have a second by Manager Matwani. Any further discussion? All in favor?
Aye.
Any opposed? Any abstaining? Motion carries. Did you abstain, Mr. Jones? Okay. Manager Jones, show Manager Jones is abstaining. Motion carries. And thank you very much. We will now proceed to the regular agenda. At this time, I will entertain a motion to limit debates for all items in the regular agenda for our meeting this evening. Do I have a motion? Manager Matwani?
I move that we limit debate to 5 minutes.
Per member per item?
Per member per item. Thank you, Chair.
I have a motion from Manager Motwani. I have a second from Manager Greenberg. Any further discussion? All in favor?
No, yeah, I just had a question. So 5 minutes per member per discussion. So if a
Per
member per item. So if a member speaks for 3 minutes, stops, someone else interjects, that means they have 2 more minutes on that item?
Yep. Yes.
Okay, and we have someone to monitor it.
Yes. I monitor it, especially when I see we're going long. But
Okay.
Perla is actually my master monitor.
Okay, all right, thank you.
Okay? Any further discussion? All in favor? Aye. Any opposed? Any abstaining? Motion carries. Thank you. Manager Valadez?
I have a question.
You can.
Dr. Bell, I'm sorry, Sir Chair Bell. I wanted to know whether or not it's possible for us to vote quickly on the tax rate and the, I guess, item 3 before item number 2.
Actually,
No, is there a reason?
There
for it
is
to
a,
be this way?
yes.
Okay.
Well, hold on. We're going to receive a presentation from Community Care. So we're going to do agenda item number 1. Then we will take up agenda item number 3. So if you give me a second, I'll lay that out.
Thank you.
All right? Members, we will take agenda slightly out of order this evening. We will have the presentation from Community Care and then vote on setting the tax rate first, which is agenda item number 3, and then deliberate and vote on the budget, which is item 2. So I would like to call up now agenda item number 1, receive and discuss a presentation on Community Care Health Centers fiscal year 2023 budget. Jason Fournier will be presenting. Fournier, sorry.
I answered the vote.
It's that French pronunciation, Jason.
It is,
It gets me every time.
Well, good evening, Board of Managers, Chairman Bell. It's our distinct pleasure to be here this evening.
Your mic?
Oh, apologies. Good evening, Board of Managers, Chairman Bell. Joining me this evening is our Chief Financial Officer at Community Care, Joy Sloan. And it's our distinct privilege to go ahead and present to you our recommended budget that's going to proceed and be presented to Community Care's Board of Directors on September 27th, later this month. Very happy to be here. Really looking forward to stepping through what our budget entails. It's actually going to be a very comprehensive presentation outlining where our expenses, revenues are, where some of the pressures are from both a fiscal perspective as well as operational priorities, so that you have a better understanding of where we are at Community Care as we're emerging and still emerging from the post-pandemic COVID-19 world that impacted healthcare very dramatically. With that stated, and as someone indicated earlier, certainly the pandemic's not done. We're dealing with it still daily, right? If we can advance to the next slide. The first slide is actually our service from last year for calendar year 2021. As some of the board members may already know, each year we report as a community health center and as your co-applicant to the Health Resources and Services Administration through and via an annual report referred to as the Uniform Data System Report. This report is readily available through HRSA, the acronym for the Health Resources Services Administration, outlines our demographic, our payer mix, cost information, as well as quality outcomes and staffing outcomes as well. As you'll see in 2021, we served the most patients ever at 125,278 unique individuals. And broken out here, you can see as well that we served a very diverse patient population. 84% of our individual patients, for those that reported the race or ethnicity, self-reported that they were drawn from a racial or ethnic minority background. So 84% of our patients. It's actually a little bit higher this year, and you'll see that in the next slide.
When we take a look at our patients as they reported, again, self-reported their income level, 94% of our patients reported income at or below 200% of the federal poverty level. So certainly out of the 125,000 unique individuals, we're really getting to Central Texas low-income individuals, and particular Travis County residents. When we take a look at it from a racial and an ethnic perspective, around 69 to 70% of our patients self-report as being drawn from a Hispanic Latino background. About 14% plus are white only non-Latino, and around 12% African American. From a percentage growth perspective, our Asian American Pacific Islanders actually from a percentage grew from 2.5% to 3.5% from calendar year 2020 to 2021. Looking at the breakout relative to gender, about 45% male, 55% female. Actually, we fare better as it relates to breakout on gender equality in services than most health centers. Tends to be about 65% female. Just for your awareness. And as you can see, our adult population still continues to have a high level of uninsurance. 69% of the 73,379 unique individuals served, of that 69% rounding up were uninsured. Then when we take a look at all of our patients, because we have pediatric population, which actually has a 17% uninsured, which is the state average for all Texans. So our pediatric population actually mirrors the state average. When we combine them together, we have a total uninsured population of 47.2%. So current, next slide, please. So current fiscal year, so this goes through August 31st, 2020. Our fiscal year starts October 1st. It's aligned with Central Health's fiscal year. We've already served almost 123,000 unique individuals. We're projecting to provide face-to-face encounters, and this isn't our definition, this is federal government's definition. So that means a face-to-face encounter, FTF, is when you actually are in front of a clinician, either through a televisit or in person, where you're interacting with a physician, nurse practitioner, physician assistant, psychiatrist, a specialist physician, could be cardiologist, pulmonologist, others. Could be a licensed independent clinical social worker or a dentist, but it doesn't include our nurse-only visits, doesn't include medical assistant care management, case management. So there's a lot more service going on besides the 470,000 we're projecting to achieve by the end of our fiscal year. Again, similar to what we reported earlier, 68.3% self-report as Latino Hispanic, but we are seeing an increase as it relates to those that are reporting in a background from a minority group at almost 86% through the end of August. Also of note is the fact that we are seeing a significant increase as it relates to individuals best served in a language other than English. It's almost 57%. A short couple of years ago, our number would have reported 32%. Thanks to the investment Central Health provided in supporting the purchase of Epic, our data is much more accurate as it relates to this, because before we were only capturing that at the front desk, now we're doing it in the back office. So it's 32% now. This is more of an accurate reflection of where we're actually serving. That's much higher than most health centers across the country as it relates to the linguistic diversity of individuals we're serving. Next slide, please. Operational priorities for us, not going to be a surprise for the board of managers, Dr. Bell, is that it's workforce for us in terms of recruit and retain workforce. As with many industries, there's a lot of competition here in Austin, but couple that to the fact that there was a lot of pressure that was brought to bear on healthcare in particular as a result of the pandemic. And then you couple that, as Joy will indicate, we're in growth mode. We have been now for the last 4 years in terms of growing. I've been with community care almost 5 years now. When I first joined, we were about 800 employees. We're now sitting at close to 1,200, and by the end of the fiscal year, we're expecting the next fiscal year, so ending next September, almost 1,500 employees. So a lot of growth there. So when we take a look at 161.2 new positions that are funded through the American Recovery Plan Act, and Joel speaks specifically about that. Other operational priorities is our continual stabilization of EPIC and optimizing its use. We continue to enhance our care model and quality infrastructure. Post EPIC go live, we're 18 months into it. We're starting to see and reap the benefits of that, but there's still some work there as well. We've been recognized by the federal government previously and consecutively for being a high quality primary care provider within the community health center world. Our vaccine efforts around COVID-19 will persist this year. And then we're also embarking on value-based care arrangements to make sure we're maximizing third-party source revenues through our managed care Medicaid programs, as well as managed Medicare programs as well. And then we're also, and this is reflective in the 161 positions, new positions, enhancing our population health management infrastructure as well. Next slide, please. And I'm going to hand it off to Joy, and she's going to take you from here for a bit.
Okay. So some of the financial pressures that we're looking forward to in fiscal year 22-23, Austin affordability and competitive workforce marketplace. We've had to make significant investments into staff wages in this past year in order to effectively hire and retain people. We're still struggling with retention, as everybody is. And so we've adjusted market wages about 11%, and we're planning on more adjustments in the next year in order to continue to bring in high quality workforce. The Delivery System Reform Incentive Program, DSRIP, is no longer available, and so there's zero that's budgeted in this next year's budget. We have an increasing supply cost. The inflation issues that everybody's facing has hit medical as well, and our supply costs. We're also starting to experience some supply cost disruptions as some of our supplies are delayed in delivery. We've got increasing pharmacy costs coupled to continued pharmaceutical manufacturers' reductions in the patient assistance programs. And so that's contracting that pharmacy margin for us. In COVID-19 public health emergency, it's expected to end, we believe, in October. And that with this end will be the continuous Medicaid enrollment requirement will also go away. And that it could potentially impact our Medicaid funding for next year pretty significantly if the state is unable to keep up with the re-enrollment applications when that begins. Next slide, please. So in this slide, if you'll look at column 1, 2, 3, 4 of the numbers, it's the fiscal year 23, third column in of the numbers, it's the fiscal year 23 proposed budget. And for our patient services revenue, we budget based upon encounter history. What does our payer mix look like? And then a little bit of assumption into what we think the payer mix is going to look like into the next year, particularly if we are sensing some changes within Medicaid or commercial insurance. We budgeted about 26% of our patient services revenue coming from Central Health Indigent Care Program, and about 34% coming from Medicaid and CHIP, and about 29% coming from pharmacy revenue service lines. And so that's kind of the bulk of our patient services revenue bucket. Then for other revenues, we have the Central Health Indigent non-fee-for-service part of the contract, which includes such things as community benefit. We have a slide that breaks that down in a few minutes. And that's about 18 million. And then grant revenue is about 32 million. And I've got a slide detailing out where that grant revenue comes from. So total patient services revenue for our fiscal year 23 budget is about 154 million, and other revenue is about 51 million. So all in next year, we have a budget of 205 million in revenue. Next slide, please. When we look at expenses, again, the third column in of numbers, employee salaries and benefits make up over 70% of our budget. We have a little bit in contract labor. Most of that is related to physicians that we contract with to provide services. And then direct patient care expenses, such as supplies, the pharmacy, cost of the medications, falls in that bucket. Indirect and occupancy, though, that's related to more of our overhead cost. So total expenses of $204 million for next year. That leaves us about in excess of $980,000 on operations. And then we have some non-operating expenses such as interest expense on a loan that we have that brings us down to about $902,000 as our budget. So as you can see, we have a tight budget when it comes to any type of an operating margin. We also have an obligation on a payable that we expect to pay out about $5 million on in this next year. And that will bring us to really a cash loss of about $4.1 million. We are expecting a fairly decent surplus this year. And most of that surplus is really the result of two things. First has been an influx of grant money related to COVID from the feds. And the second part of that has been the struggle that we've had to hire and retain staff. If you'll notice on the very top line, employee salaries, fiscal year 22 budget was $92 million, and we're expecting to come in around $85 million. And that is because we've had a difficult time really hiring and retaining staff and expanding the programs the way that we expected. This is not unique to community care. It's across all health centers. And in fact, at a national association meeting I was at a couple weeks ago, they mentioned an audit. They had BKD come in and do a kind of an assessment on the health of health centers. And they found that during the COVID period, there was a large influx that caused days cash on hand to rise significantly, operation margins to be very positive for most health centers across the United States. And now they're starting to see the decline because that was a one-time infusion of cash. And so now we're having to figure out how do we maneuver from here once that is over with. Next slide, please. So our sources of grant revenue, in the federal grant bucket, most of that is coming from the COVID Health Center ARPA funding, about $15 million this next year. About 70% of that will be spent on staffing expansion of services and also some infrastructure build out, such as our care model training and enhancing our support for our physicians. We know that that's a gap we're going to have to fill in a couple of years. And so we're also looking at operational ways in which we can increase revenue sources to help offset that when the funding is no longer available. The remaining parts of our grants really are about the same year over year. We don't see big changes in our federal grant. Unfortunately, I'd love to see that climb higher. Does not keep up with inflation. And we are pretty steady with our funding on the HIV/AIDS services through the City of Austin and the DHHS. So about 28 million, it was in the fiscal year 22 budget, and about 32 million is in the fiscal year 23 budget. Next slide, please. So for our central health requested funding, this is kind of a breakdown of the major service lines. So we've got medical, dental, behavioral health, and specialty, which are paid per encounter. We have alternative visits that that cover some of our support care teams that support our providers. Pay for reporting, pay for performance, and the PMPM, and then the community benefit dollars that pay for the cost of family planning, HIV care, and pharmacy benefit management. And then in the fiscal year 23 budget, there's about $300,000 for durable medical equipment. So about $59 million is in the budget for fiscal year 23. And that represents about a 7% increase over fiscal year 22 budget and about a 17% increase over where we are projected to end this year. And that the lower amount for this year is tied directly to patient encounter volumes that we have not seen return to pre-COVID numbers since the pandemic hit. And we are still pending final negotiation. Next slide, please. When we look at service delivery and budgeted providers, this slide just shows you kind of the breakdown of all the disciplines that we offer through community care and how much we expect to see on encounter volumes. About 539,000 encounters are budgeted for next fiscal year. That is a significant increase from where we're ending this year on projections. Part of that, about 39,000 of those encounters are tied to new initiatives and growth, such as Dale Valley, Hornsby Bend, Pflugerville, and Chalmers. as well as additional providers within some of our sites where we have space. And this will be provided by 239 providers. And it makes up the gamut of what we offer. And as you can see, we've got therapists and therapy assistants in there. That's because through our carousel locations, we do offer physical, speech, and occupational therapy to our pediatric population. Next slide, please. Then our payer mix for fiscal year 22-23, this will show you 21 actual, 22 projected, and 23 budget is green. We are showing about 38% of our encounters will come from Medicaid and CHIP, and about 37.5% will come from MAP and MAP Basic. And then we've got smaller percentages for the other payer lines. And the percent of total population expected to be uninsured during the fiscal year 22-23 budget is about 48%. And the percent of adults projected to be uninsured is about 68%. Next slide, please. When we look at our sources of funding compared to our fiscal year operating expenses, as you can see, our operating expenses have grown significantly in the last, well, since 2014, really. In the last probably 3 years, we've seen the most significant growth as we've expanded services. And this is compared to the Central Health and CCC MDS payments and the district payments, which as you can see in fiscal year budget 23 at the very last column is 0, and the community benefit payments and then all expenses. So it kind of gives you an idea of how much of the Central Health funding is really helping offset some of the operational costs. And it signifies how much we've been able to kind of diversify our funding and bring in other resources to help keep those costs in line and more reasonable and help us continue to operate and grow. Is there anything you'd like to add to this slide?
No, right now.
Okay.
I think we're good.
Next slide, please. You were going to take over now.
Yeah, so go back one slide, please. So to Joy's point, I think one of the things that we're trying to do always is to leverage in and maximize all revenue sources as it relates to our services in providing comprehensive medical, dental, behavioral health services, and then to a lesser degree, specialty care services. That's why we're so pleased that Central Health will be expanding directly your provision of care as part of your fiscal year, inclusive of specialty services. We see that as a significant need, as demonstrated through your health equity plan that's been endorsed by this board. So really appreciate that. What this slide demonstrates that over the course of, so I think most of you are aware, Community Care and Central Health absorbed the clinics from the city of Austin in 2009. And that was following, of course, the vote in 2004 to form Travis County Healthcare District, 5 years interlocal agreement to get to 2009. So this is just a run rate. And you can see where we started years ago. It's the top is a little blurred, but it was over 70% of the budget was provided through local taxpayer dollars. One of the things that we've been deliberately trying to do is to expand services to the most vulnerable populations within Travis County, inclusive of all lifespans. And so City of Austin very admirably for decades concentrated on adults. We, as you know, had an opportunity to go ahead and acquire Carousel Pediatrics back in 2019, and we did so. That instantly went ahead and added another 35,000 pediatric patients to our overall roster of patients annually. With that stated, and for your awareness, in 2007, in a site visit through the federal government, so they also come on site every 3 years. They do an independent audit of our services. They make sure that we're compliant with the federal government guidance as it relates to community health centers. 2017, they were strongly encouraging us to look at diversifying the payer mix, which meant try to gain some more Medicaid. They were concerned about the long-term financial sustainability. We're in Texas, which is not a Medicaid expansion state. So there's 2 areas that you can do that. That's pediatric and prenatal. And we have had a longstanding strong prenatal population and program. So it was really pediatric. So when you look at the growth in the Medicaid side, it's really attributable to that pediatric population. But for your awareness, It hasn't come at a compromise for what we're doing on the adult side. In fact, with support through Central Health, which is so appreciated, we've been able to expand that over the years. Of course, COVID threw us a curveball in terms of the overall services. And as Joy indicated, we're still rebounding from that as it relates to the services. Part of that is we're also seeing a higher level of vacancies in our providers than we had prior to the last couple of years and dating back to 2017, 2018. We're very fortunate. We're faring better than most health centers and other private providers, but still there's an impact there. So when you take a look at it, we're projecting based on the budget, as Joyce outlined for you, about 29% of our overall budget will be directly supported through your action in the budget this evening that allows us to sustain and support the services that are so needed by the communities we're privileged to serve. If you want to go to the next slide, please. And this is a similar one, but what it does is it actually overlays and looks at a leveraged funding model that demonstrates what the cost of service would be if you looked at from 2010 forward and you just applied consumer price index inflation rate, which is indicated in the purple bar versus the green at the end. And then on the far right, the US healthcare inflation rate. And so when we take a look and fast forward, what we've been able to do over time is really try to keep the cost of providing services from an efficiency, a quality perspective, a comprehensiveness perspective, lower than what the US healthcare inflation rate has been. And this demonstrates we've been quite successful at that. Next slide. And this is based on all payments that we receive for uninsured patients within our arrangement with Central Health. This next slide similarly goes ahead and demonstrates that at the top, the first one, if you look far right or far left, 3.42 is CPI back in 2009, and then you see the trend over. Unfortunately, what we're seeing now is, of course, more in inflation on the CPI side. Healthcare inflation is starting to catch up. It's sitting at 4.8%. We've got in our budget for supplies alone a 4.5% increase. So again, if you take a look at the trend, we've been quite successful over the years in keeping the cost down per encounter for MAP basic comparative to where we were actually in 2010. It was $309.24 all in. And this year we're projecting $302.49. Again, a leveraged financial model that's allowed us to do this. One of the things that Joy pointed out, one of the biggest components is our pharmacy program. While you'll see $45 million in pharmacy revenue, please note that a large majority of that's also offset by the cost of goods, getting those supplies. But it's still, there's the opportunity there for us to generate revenue that comes back in and supports the overall services to the tune of about $15 million to the good. Next slide, please. And by comparison, our pharmacy program a short 5 years ago was $10 million. That's how much we've grown that deliberately as well. So if you take a look at comparative to national benchmarks, our costs are going up faster than others relative to a 3-year trend, but that's been deliberate. Thanks to support through Community Care, Central Texas Community Health Center doing business with Community Care Board of Directors several years ago, they approved the compensation plan and philosophy. We actually executed on the full 4 phases earlier this year in March. That's in reference to what Joy shared earlier, 11% increase overall for our staff, but that's coupled to increases that had happened before. So we were playing catch up. By way of perspective, 5 years ago, starting medical assistant coming into our employee was coming in at about $13.50. So we were underinvested there. What we've done now is we are paying a new graduate medical assistant above $20. I won't say exactly the amount because others could be listening, right? Relative to that, that's okay. We could share with our peers. A little bit over $20 is what we're starting our medical assistants coming through the doors with us, right? Which is a big change in less than 5 years. And so when we take a look at it a couple of years ago in 2020, we with you went ahead and set the floor for all of our employees at $15. We did that, and you fast forward to today where the conversations in the community are, right? So there's that aspect of it as well. So this trend goes ahead and says we've got a little bit of an increased expense, but most of that is investment in direct personnel. And when we take a look at where we are from administrative expenses, we tend to be lower than most community health centers, and especially the larger public community health centers that are similar to us, we're definitely lower. If you look at the bottom, this just shows the strength of the local support that we're receiving currently, but it dates all the way back to 1970 when the first health center here in East Austin opened at 4th and Kamal, which is local support to support access to primary medical and dental care, behavioral health care, starting back in the 1970s. And over time, we added the community health centers into the mix starting in 1992 with the first grant received in 2001. What you're seeing though is there's a big difference between what we receive on a per patient basis versus what other health centers across the country receive. On average, they're $163.99 for at the national level for 2021. At the state level, I should say, a little bit more at the national level on the far right there, and we're at a little bit less than $55. So we can't do this without the support of Travis County taxpayers and without your support here of the board. It's such an instrumental and strong, critically important component of what we do. Next slide, please. So Joy's going to take this one and I'll take the next one. Okay. Joy?
So some key takeaways: about 140,000 patients with over 500,000 face-to-face clinician encounters are what we're kind of anticipating for the next fiscal year. It's an imperative that that our service delivery returns to pre-pandemic levels, plus expanded services, because that's what the budget's based on. So without that, we would have to make some adjustments. Positive operating position projected through this, which is offset by an outstanding payable. That's projected to reduce cash reserves by about 4.1 million. Encounters are about a 20% increase over what we project we're going to achieve this year. So it's a pretty big reach. Overall expenses increased 17% from the 21 budget or 22 budget and 17.8% from the 22 projections. Sorry, those numbers are wrong. The years are wrong. And almost 15.4 million in ARPA funding that helps offset the loss of DSRIP. We were running about 10 million a year prior and about 4 million this year. And now that that's gone, we're using some of the ARP funding to help us bridge that gap. Allows for investment in population management infrastructure, care team capacity, training staff, and capital such as new dental equipment, infection control equipment. And we are adding capacity and care model investments that must result in service delivery and expansion. To offset the loss of the ARPA funding in a couple of years.
Next slide, please. And so the last couple of key takeaways. One is, again, so critically important for us is workforce development, workforce retention. We're developing a care academy within community care, which is very purposeful. That's going to extend beyond just our direct clinical support team, but also our community health workers and others. We've grown our cohort of community health workers as well. We're actually adding another one later this month for dedicated towards the Black Men's Health Clinic that we'll be providing to that location. We also, as we have already mentioned, we've diversified the payer mix overall. Those are things that we're continuing to do. We also recognize that there's still others within the community that still need access to care. And thanks to your support, we're able and very deliberately looking to target expansions in those areas, especially as we start looking at the continued realignment of the health centers as they currently stand. So as Del Valley comes online, as Austin's Colony comes online, as Pflugerville comes online, there's changes that we're going to see with some of the other health centers as well. And we'll look forward to updating you at a future meeting based on when Mike would like us to come. If you take a look overall, the budget contribution asked of Central Health is 29%. We're projecting about 35.2% of our payments will come and services will be directed towards MAP Basic. Of note, though, that's not all the Travis County residents that we serve. There's folks that come in, walk in, that haven't been screened in our walk-in clinic. Same thing with dental, literally thousands of folks that come in that way, and there's no way to have done the pre-enrollment And so we just provide those services. It's included in part of our agreement as a whole to do that, just so we have awareness. So that's understating the overall amount of folks. When we are projecting 48% of our over patients to be uninsured, the vast majority of those uninsured individuals are coming from Travis County. We certainly do serve some folks from outside Travis County, but as you saw in the report that we provided to you as well, the top 10 zip codes are all Travis County and count for almost 70% of our total patient population, or 60% of the total patient population we're currently serving. And then, as I mentioned, compared to other health centers, and in particular, large public health centers like Denver Health and Valley Wise out of Arizona, we are actually demonstrating a higher level of cost effectiveness than they are, comprehensive services, and at the same time, still hitting national quality benchmarks and continue to do that. We just were recently recognized by HRSA as one of the health centers in the country that is advancing social equity as it relates to parity from a healthcare access perspective. And that's the first time we've ever gained that recognition through the federal government. So pleased to report that as well. Next slide, please. And we're at the point where we're happy to take any questions Dr. Bell and your peer managers may have for us this evening.
Jason, Joy, thank you very much. I appreciate that very thorough and comprehensive overview of your budget. I know that I'm going to have questions from the managers, but one of the nice things about being chair is I can go first. I know that there is a collaborative between you and the Black Men's Health Clinic, and that you guys are providing some primary care services there. Is there a, I mean, how many patients are, I know it just started, so how many patients are you guys seeing there since you started?
So, we've been, so it's 2 evenings a week right now, and it'll ramp up based on demand. So it's Tuesday and Thursday. It's been a handful of patients so far. Okay. Part of the objective is to reach the hardest to reach individuals within our community. Men as a whole, and speaking as a man, we don't like to use healthcare services.
That's correct.
And to the public speakers earlier, our African-American men and men of color have been marginalized for many different reasons, but most notably for systemic racism and bias. And so engaging in healthcare deliberately can prove more challenging for our brothers of color. And the main thrust behind what the Black Men's Health Clinic is doing is to provide a safe space for folks to come in because we're trying to capture folks who haven't been in care. That's going to be the toughest individual for us to reach, right? And so we think that there's a need for awareness and to create further awareness about what that clinic offers, as well as the rest of the assets within community care for all men within our community, and of course, women and children.
And so outreach would be important as we look forward to increasing the number of individuals that have access to your services there.
Unequivocally, yes.
Okay.
Yes.
Thank you very much. I saw some hands. Can I get, okay, Manager Musaikin?
Well, thank you for your presentation. Appreciate it. Just one side note comment. Your slides, like my brain just goes all over the place with trying to follow your data. But for me, they're quite a little too busy. So just for future reference, I'm assuming it's really hard to follow. And there's a lot of information and you want to capture it. But just that side note.
No, thank you for that feedback. We'll try to make it easier.
It's like so many numbers, like, okay, trying to follow on the colors. So just that note on your slides, but thank you. I have a few questions and some of them are really quick. Your CPRIT funding, who's the PI for that?
So it depends on which one, but Dr. Pignoni.
And he's from the Dell Medical School?
Correct, yeah.
Okay.
And that's a joint project with them for multiple things, but specifically chest x-rays right now for
okay. And you have about 127, you said, physicians?
280 total, but yeah, the physicians themselves, I don't have that number memorized.
And how many of them are associated with Dell Medical School?
So the vast majority of our physicians are directly employed. So the ones that are not directly employed are going to be the ones affiliated with the residency programs that we host. So family medicine residency program is the largest. We have about 4.2 to 4.3 family physicians that are coming through. Internal medicine, so it's approximately 3 that come through that
So
way.
how many residents do you have?
We're actually one of the largest teaching health centers in the country. Each year we host over 250 physician residents coming through. We of course have other students that are coming through, nurse practitioner, physician assistants, medical assistants, nursing students, but physician residents over 250 annually.
That's wonderful. And many of them, once they complete the residency, do they tend to be hired locally, do you know, or is it a sense?
Well, we are certainly trying to capture as many of
Are you
the
recruiting
primary
them?
care docs. We also host specialty residents coming through as well. But the
Okay.
family medicine, some of our most recent, we've had such high caliber physicians, but I can think of several that have come from the local family medicine residency program that we've actually retained and hired. One of them is our director of infectious disease at our David Powell Clinic.
Wonderful. Now you mentioned about your EPIC implementation, and I know it's recent. So, but I'm also wondering, you're also trying to establish a population health department. I think that's very critical. Are you able to assess currently the prevalence and the trends of some chronic illnesses within the community and address the disparities of the population that you currently see?
So we absolutely, for our patients, we have that information in data. At the community at large, it's a little bit more challenging. We have to do some synthetic analyses, but for our patient population, we absolutely have the burden of disease by diagnosis. We have that, yes.
Now, in terms of the wait times, I know there was an issue in the past, and have you been able to improve on the wait times with patients, and you want to enhance patient experience? I think you outlined it in one of your slides.
Yes, so there's 2 different ways to slice that. One is for established patients, the lead time is usually less than 10 days in order to get a visit. For new patients though, that are coming into the system, it's closer to 30 days in terms of their next available. We could do better, but it's better than what it once was. As it relates to, and back to EPIC, when we take a look at the turnaround time check-in, it's so much more improved.
So do you have same-day appointments?
We do, and we're expanding that through our chief medical officer and our staff. So part of that is to actually get closer to doing more advanced open access. And so that's something that they're charged with doing. There's a team working on that right now. And then the true same-day access is coming through our walk-in at both Hancock and at Southeast Health and Wellness. But we're also looking to expand the number of clinicians that are there. Unfortunately, at our walk-in clinics, that's one of the areas where we have struggled to recruit physicians.
And my last point, the Texas Department of Health issued a grant applications for FQHCs and about $500,000 that you can receive, and that could be targeted toward operations. Are you familiar? Are you considering applying for that grant?
Yes, we are.
Okay.
And there was a second one for $350,000 for COVID response, and we're responding to that one. Well, we've actually responded to that one. So yeah, both FEMA based, yes.
Thank you.
Yeah, thanks.
Thank you, Manager Saidi. Any other hands? Manager Valadez.
Thank you. Jason, on your breakdown of the circles.
Yes.
Is it possible for you to get to us the male, female, ethnic, race, demographic?
Absolutely. We can slice that any way you want. We've got that info.
I'd like to see that. And with respect to the clinic visits per service area, if it's possible to let us know what clinics they're going to, so that we'll know what services are at each of the clinics. I know that a few years ago, I would see synopsis of the I guess the number of patients that were going per clinic that you all had within your system, and I haven't seen that in a long time.
So we'll make sure that we add that to the fourth quarter report for this fiscal year.
Okay.
And so we'll break out both by encounters
Yes.
at the sites. And then it's a little bit trickier to get to unduplicated patients.
Right.
In terms of, because our patients go to multiple sites. So we'd be overcounting the patients, but we'll certainly and minimally get you the encounters. And then we'll do a ballpark of where their medical home is and give you unduplicated patients that way.
Right, and I know that one of the things that they were using that information for was to determine whether or not we're gonna shut down a particular clinic based on use or non-use. So I don't think you have any of that to be afraid of. I don't think you have to worry about that anytime soon.
Well, I think we are, Manager Valdez and Board of Managers, still realigning our services. So for example, when Pflugerville opens, the pediatric residency program is expected to move to Pflugerville as opposed to down the street here in East Austin.
And gentrified East Austin? Yeah.
Yeah, you probably saw a couple of years ago, Austin American Statesman indicated that there were more dogs now in East Austin than there were children. So it's that's not the reason why we're doing it. By the way, our data is a little bit more
And
robust.
more students in the school, there are fewer students in the schools. So anyway, yes, thank you.
Yeah, of course.
One more thing on the negative 4.186 million that you're down. Now, why do you think that is?
Well, we have an obligation due as it relates to the acquisition for Carousel.
Okay.
So that was planned. It was aware we've got healthy reserves to be able to cover that.
And that's just for this fiscal year, correct?
For the upcoming.
Leveled out further down the road.
No, this will conclude our obligations relative to that.
Great.
So we have a note for the initial obligation, but this will, that transaction concludes as of January 27th of 2023. So those financial obligations, other than the note that we have with the banking institution here in town, goes away. So what's being presented is we're going to end the fiscal year in a negative cash flow position, but a positive operating margin is what we're projecting.
Great. I think that was it for me, other than the medicated chip.
Okay. Quick.
Very quickly on the medicated chip, you know, the 38% over here on this slide.
Yes. Mm-hmm.
Okay. And that's attributed to, and would you support the enterprise expanding into Medicaid to increase the pharmaceutical and all the other services that could benefit our community care patients?
So what was the first part of the question?
With respect to the medicated chip.
Oh, just overall?
Yes, overall.
So I think we partner with a lot of health plans in the area, Superior being the largest, Blue Cross Blue Shield. So we work very closely with them. I think my experience is that when you have a health plan that's close and within the enterprise that is similarly minded and motivated, that's an advantage. And we can actually negotiate, and it's still arm's length negotiation where the provider, they're the plan. But I would be confident that our community would be just as advantaged, if not more advantaged than any other health plan. Medicaid MCOs are critically important to what we do.
I appreciate that. Thank you,
Yep,
Jason.
of course.
Thank you.
Thank you, Manager Valdez. Manager Jones, did you have something?
Yes, first of all, thank you for partnering. I heard you say, and I'm aware that there's a need to ramp up. I know one of the critical aspects of that is making sure and I think as a board, it's important that we emphasize that we take a role I don't want to say all that over again, do I? I think it's important that we emphasize the importance of getting people aware of the clinic, getting them enrolled, and letting the community know in order to make a difference in these numbers. I don't know if most people know, but if you look at the mortality rate, particularly in this community, African-American males still have the least life expectancy of all populations. And so I think it's important that we address this, and this clinic goes a long way towards doing that. So as we look forward to this next year's budget, I'm going to be supportive of us doing something to make that difference. So,
And I think Manager Jones, increased awareness about the activity and connecting things into services is critically important. And it's our distinct privilege to partner with the Black Men's Health Clinic and with Larry Wallace and what they're trying to do to increase awareness, but more deliberately get services directed towards men.
it's a Black men's clinic, but the services are provided to all men of color. And so that we want to emphasize that, so it's not viewed in a different light. So thanks very much.
Yeah, we're working with our partners to look at ways to make sure that message is communicated effectively and deliberately.
Okay, any further questions?
Just one last quick, fast one.
Extremely.
With respect to that, because I'm also in support, great support of the Black Man's Clinic, and I was wondering whether or not it would be anything, whether or not you all might consider maybe a Sunday clinic for those, I look at the Latino males who don't have any time off. They work, they go get ready to go to work at 5 o'clock in the morning. They're on the job at 5:30 or 6. They don't get home till 7 or 8 at night. And that's at least Monday through Saturday, if not some Sundays. So if I would really be hoping that you would consider expanding to a Sunday clinic, at least on a part-time basis, to see whether or not there's a way to capture that population. Thank you.
Thank you, Manager Valadez. Appreciate it.
Great suggestion, Manager Valadez.
I think that's a great idea. All right, hearing no further comments or questions, thank you again, Joy, Jason, appreciate it.
Thank you.
Appreciate all the time. I appreciate your
Appreciate
work.
all you guys do and your support. We can't do this without our partners here at Central Health. So thank you so much. Yeah,
Thank you.
Thank you very much. Okay, agenda item number 3. Discuss and take appropriate action on Central Health's proposed fiscal year 2023, tax year 2022 tax rates. A, total maintenance and operation tax rate, which is a roll call vote. B, total debt service tax rate, roll call vote. And C, total ad valorem tax rate, which is also a roll call vote. Jeff Knodel and David Duncan will be presenting. Members, just so you know, this is the very technical part of what we do here as a Central Health Board. So I ask that when we go and begin making motions, that you read your motions very carefully and to the word that is printed on your motion sheet. I think I'm turning it over to Jeff.
Thank you, Chair Bell. Jeff Knodel, CFO, Central Health. With me is Lisa Owens and John Morgan with Central Health. And thank you for that opening. This part is a very technical part related to the Central Health fiscal year 23 ad valorem tax rate. So there are two pieces, two components of the property tax rate, the M&O portion, maintenance and operations, and the debt service. And those two components combine to a total ad valorem rate. In fiscal year 23, the proposed tax rate of 9.8684 cents is a rate that is a 6% increase over the maintenance and operation, and excuse all the technical terms, but it's just, it is what it is, the no new revenue rate. So 6% on the M&O. One of the analysis that we look at as it relates to the property tax rate that we propose is what's the impact to the average homestead in Travis County. And the proposed budget for fiscal year 23, the proposed tax rate, even though it's an increase of 6%, the overall impact to the average homestead looking at fiscal year 22 and 23 is a decrease in the overall tax bill for the homestead of almost $4, actually $3.99. Tonight in the motion, and again, it's fairly technical language, we'll be adopting both the M&O, the maintenance and operations rate, the debt service rate, and then the total combined tax rate. Before I turn it over, just as a reminder, earlier this year, you, the Central Health Board, and the Travis County Commissioners approved the homestead exemptions, increased the homestead exemptions for 65 and older and disabled homestead owners from 100,000 to 110,000. And just as a reminder, the actual homestead exemption remains at 20%, which is the maximum amount. That's not part of tonight's action, but just a reminder of past action that you've taken related to the upcoming tax year. So again, the language is fairly technical. I'm going to turn it over to David Duncan for a little more detailed instruction, and then we will hopefully proceed to a roll call vote. Thank you.
Mr. Duncan?
Thank you, Mr. Chair. David Duncan, Travis County Attorney's Office. I just wanted to explain to you all, when you read these motions, the language is, the structure and the grammar is tortured. And it's because the legislature makes us do it this way. This motion, these three motions, the wording of them is actually set out in the statute in quotation marks. It says, you must make the motion as follows, colon, these words. So it has to be done exactly like this. And the reason the bill's going down, but the language of the motion says increase the tax rate, is the way they define, so that 6% over M&O, no new revenue rate. So it is, when you look at the amount of money we collected last year for maintenance and operations, and then you take the amount we will theoretically collect based on the tax roll for this year, and you compare those two numbers, the difference is 6% more this year. That is the legislature's definition of when you need to take a vote of the board to quote unquote increase your tax rate, even when a typical household will pay less. The reason the amount's going up is there are more properties to tax, and some of the larger properties, some of the more expensive properties, their bill will actually go up, but you have to get way up in the brackets before that happens. So apologies for the wording of the motion, but they do have to be read exactly as they are written, because that's what the legislature says. So that, I just wanted to explain that, because it is, when you read an increase of a negative number, you know, a mathematician would tell you that's an absurd way of saying that, but the word increase is actually in the statute. Thank you.
Thank you very much, Mr. Duncan. Any questions for Mr. Duncan before I go on? Because I'm going to remind you again of what he just said. This item is the consideration of the revised tax rate for tax year 2022, which funds the Central Health fiscal year 2023 budget. Which we will take up next. This is the tax rate only. It does not affect the homestead tax exemptions for residents over the age of 65 and residents who are disabled or veterans, which have already been approved by the Travis County Commissioners Court. Each subpart of this item will require a roll call vote. For this roll call vote, Mrs. Giannis will call the name of each board member in attendance. Each board member must indicate whether they are voting yay, nay, or abstaining from a vote on the tax rate. Ms. Giannis will confirm your vote before moving on to the next member to ensure that we have an accurate vote tally. To ensure compliance with the requirements of the Texas Open Meetings Act, each manager should wait to voice their vote until the camera is directed at them and Ms. Giannis asks for their vote. I will now accept a motion from Manager Zamora.
For the maintenance and operations tax rate
I move that the property tax rate be increased by the adoption of a tax rate of 0.096604 cents, which is effectively a 6% increase in the tax rate.
Thank you. Do I have a second?
Second.
I have a motion from Manager Zamora. I have a second from Manager Valadez. We will now have the roll call vote.
Okay, and I'm going to go from right to left again. So I'll start with Manager Amit Matwani.
Yes.
Manager Amit Matwani votes yes. Manager Shannon Jones.
Yes.
Manager Shannon Jones votes yes. Manager Maram Musaitif.
Yes.
Manager Maram Musaitif votes yes. Manager Julie Zuniga.
Yes.
Manager Julie Zuniga votes yes. Manager Sherry Greenberg.
Yes.
Manager Sherry Greenberg votes yes. Manager Cynthia Brinson.
Yes.
Manager Cynthia Brinson votes yes. Manager Charles Bell.
Yes.
Manager Charles Bell votes yes. Manager Cynthia Valadez.
Yes.
Manager Cynthia Valadez votes yes. Manager Guadalupe Zamora.
Yes.
Manager Guadalupe Zamora votes yes.
Okay, hearing a unanimous vote, the motion passes. Section B. I have a motion from Manager Greenberg.
For the debt service tax rate, I move that the property tax be increased by the adoption of a tax rate of 0.00280, which is effectively a negative 20.3% increase in the tax rate.
Thank you, Manager Greenberg. Do I have a second? Manager Valadez, second. So I have a motion from Manager Greenberg. I have a second from Manager Valadez. Ms. Brianna Yanis will now assist me in taking a roll call vote.
Manager Amit Matwani.
Yes.
Manager Amit Matwani votes yes. Manager Shannon Jones.
Yes.
Manager Shannon Jones votes yes. Manager Maram Musaitif.
Yes.
Manager Maram Musaitif votes yes. Manager Julie Zuniga.
Yes.
Manager Julie Zuniga votes yes. Manager Sherry Greenberg.
Yes.
Manager Sherry Greenberg votes yes. Manager Cynthia Brinson.
Yes.
Manager Cynthia Brinson votes yes. Manager Charles Bell.
Yes.
Manager Charles Bell votes yes. Manager Cynthia Valadez.
Yes.
Manager Cynthia Valadez votes yes. Manager Guadalupe Zamora.
Yes.
Manager Guadalupe Zamora votes yes.
Thank you, Ms. Yanis. We have a unanimous vote on Section B, and the motion carries. Section C, Manager Matwani will provide me a motion.
For the total ad valorem tax rate, which is the sum of the maintenance and operations tax rate and debt service tax rate, I move that the property tax rate be increased by the adoption of a tax rate of 0.098684, which is effectively a negative 11.7% increase in the tax rate.
Thank you, Manager Matwani. Do I have a second?
Yes.
I have a second. I have a motion from Manager Matwani. Sure. You need sense?
Sense.
Do you want to repeat?
Acknowledged.
We good? Okay. All right, I have a motion from Manager Matwani. I have a second from Manager Valadez. Any further discussion? We will now take a roll call vote.
Manager Amit Matwani.
Yes.
Manager Amit Matwani votes yes. Manager Shannon Jones.
Yes.
Manager Shannon Jones votes yes. Manager Marami Saitif.
Yes.
Manager Marami Saitif votes yes. Manager Julie Zuniga.
Yes.
Manager Julie Zuniga votes yes. Manager Sherry Greenberg.
Yes.
Manager Sherry Greenberg votes yes. Manager Cynthia Brinson.
Yes.
Manager Cynthia Brinson votes yes. Manager Charles Bell.
Yes.
Manager Charles Bell votes yes. Manager Cynthia Valadez.
Yes.
Manager Cynthia Valadez votes yes. Manager Guadalupe Zamora.
Yes.
Manager Guadalupe Zamora votes yes.
Hearing the roll call, we have a unanimous vote in favor and the motion carries. Members, thank you very much. We need each of you to sign the tax resolution that was provided in your backup materials. Brianna Yanis will be reaching out to you to find out the best way to obtain your signature. The tax resolution summarizing these votes will be presented along with the budget to the Travis County Commissioners Court on Tuesday, September 20th, 2022. Okay, agenda item number 2. Receive and take appropriate action on the proposed Central Health fiscal year 2023 budget. Jeff Knodel and Lisa Owens will be presenting.
Thank you, Lisa Owens, Deputy CFO. So as Jeff presented and was approved, our proposed tax rate for this year is 9.8684 cents for $100 of valuation. And that does result in an estimated $281 million in property tax. Our sources of funds have not changed since our last presentation. However, as you noted in the packet that you received, we have made a slight change to our healthcare delivery uses, which I'll go over in a minute. Our total proposed sources of funds for the fiscal year 23 year is $300,750,381. We also have uses of funds in the amount of $283 million, administrative and tax collection $22 million, for a total of $305,358,237 uses of funds. As a result, we do estimate that we will have sources less than uses. And so another change since we were here last with you is that healthcare delivery contingency reserve has gone down a little bit as a result of using some of those reserves to fund the estimated uses for fiscal year 2020. Our major increases in our budget this year over year, are over $90.5 million in healthcare delivery program. Remember, we just have healthcare delivery and administration. Those are outlined here in our presentation, and we've talked through them at length in previous meetings. However, significant investments in extended primary care, post-acute care. We're very excited about the specialty care at Rosewood Zaragoza, increased specialty care, behavioral health access, and then additional pharmacy services. A few highlights. I also know we received a great presentation last week about the community engagement on this budget, the significant outreach that was conducted in the report that you received the highlights of through community conversations, advisory committees, and surveys. And this just summarizes the estimated 630 participants that gave feedback throughout the budget season. We also maintain our financial accountability through areas like our clean audit opinions for our annual financial audits, our strong rating from Moody's, as well as 3 years of GFOA Distinguished Budget Awards. We will be pursuing that again this year. So we've talked through the tax rate and the sources and uses. Since we did make some updates to these numbers, I'll walk through those in a little bit of detail here. In primary care, since we were here on the 24th, we did increase that line item to $66,236,822. That's a $125,000 increase. We also added $2.775 million to our specialty care, increasing in areas where we've been having evolving discussions about different areas of specialty care, additional developments in proposed efforts. And then just a $40,000 increase in what we showed you earlier last month, in behavioral health to $12,040,000, and then a $100,000 increase in post-acute care to $5.65 million. No other changes were made in the uses of funds, so our proposed purchased healthcare services, purchased from contracted providers and partners in the community, $129 million. As I mentioned earlier, this year we will be hiring and staffing the Rosewood Zaragoza Clinic, which we're very excited about, as well as the investment in the facility in our capital budget. These direct healthcare services in the areas of podiatry, cardiology, neurology, gastroenterology, nephrology, and pulmonology, as well as other diagnostics, we estimate to be about $5.6 million, $5.7 million to get started next year. Our total healthcare services are $137 million. We also have our operations and support, which we've talked about. There's been no changes to these numbers since we presented to you earlier. Our premium assistance programs, our partnership with Sendero to offer those premiums for patients who are enrolled in their programs, additional salaries and benefits, and other operating costs in our departments that make up our healthcare delivery program. And those are all outlined in the presentations that we shared and on our website, which of our departments make up the healthcare delivery. Those are the teams that support the operations service delivery. We also have our debt service, as we've talked about just recently, the debt service rate, debt service payments that will be due this year, as well as we've talked about before, a $49 million transfer into our capital reserves, which will provide funding for the Rosewood Zaragoza Clinic, other clinics costs, as well as projects just in general facilities upkeep, technology investments that may arise, and those will be cash funded through the cash reserves if needed. And then our UT affiliation agreement, $22 million. So our total healthcare delivery is at $283,208,877. We have not had any changes to the administration program. However, we do have the information from our presentations and on our website about our investment in additional administration functions in order to support the growing healthcare delivery program. As well, we have a new investment this year, some cash for self-insured employee health benefits as we've moved to self-insured for our health benefits for our employees. So again, our total uses of funds, $358,237. We've had a great budget season starting back in probably February at strategic planning, but in May when we presented the long-term forecast. Tonight, we are here to adopt the budget after adopting the tax rate. We are going to the Commissioner's Court tomorrow for a work session. As well, then we will return to the Commissioner's Court on September 20th for the final vote on the tax rate and the budget.
Okay. First of all, I'd like to thank you, Jeff, Lisa, and all your staff for all of your work in this preparing this budget. It takes a lot to get from the beginning to here, and a lot of work, a lot of analysis, a lot of number crunching. And so we really do appreciate what you do and how you put this together. It seems very easy from our viewpoint, but I know there's a lot of work that goes on behind that. And you too, John, because these budget numbers represent program activities. And so to be able to mesh those two, it's important. I have one comment and, well, yeah. Thank you, Rob. I have one comment and then a couple of questions. The one comment is, in your healthcare service delivery administration, those are what we call administrative costs that are spent to deliver the healthcare services. That's why it's separate from your administrations table that really looks administration of Central Health, the organization. Is that correct? Right. Okay. And I guess my reason for calling that out is because it seems that there's a misunderstanding that all we should pay for is just the delivery of a service, direct delivery of a medical service to an individual. And there's a lot more that's required of us to provide healthcare to the population than just a medical service to an individual. And those are actually captured in that operational cost of being able to deliver those services. So I just want to make it, it's not that we have this dual administration. It's the fact that we have administration, of which it is on your table, but then we have operational and administrative costs to carry out the programming of being able to deliver healthcare services to the individuals that we serve.
Yes.
Okay. The other question really comes from the public communication. Is there money in the budget to pay for a, what are we calling that? Help me, the audit, the performance audit.
Yes, consulting dollars are in for our planned performance review.
Yes.
At the 5-year mark, we will procure that this year.
Okay. And there was another question about the CCC, whether or not, I'm blanking on the exact wording of that question. Did anyone happen to? Yes, sir.
If I may, what I recall, it was actually a two-part question around how do we balance the budget and the CCC. I didn't quite fully understand maybe the context and the background to it, but just working off those two key words. We balance the budget. We have tax revenues and some real estate revenues, tobacco settlement revenues, and then there are reserves that you all are well aware of that provide structural balance, and I can let the finance team go into more detail on that. On the CCC portion of the question, that is still an active organization, and it's got monthly financial reports that are presented to this body, as well as an annual audit that's rolled up and presented along with our annual report with the other component organizations. And so but again, not fully grasping what the context and the background was. I'll offer that information for the time being. I don't know if there's anything else that.
Yeah, just to elaborate a little bit more on balancing the budget. We've had many years of discussions of building reserves. You'll notice this year, if you look at Schedule A, the actual uses are more than the sources. So the spend is greater than the revenue, but that's possible because you have reserves down at the bottom line that you're utilizing. So that's how we balance the budget, is through the use of reserves. And that's exactly what that contingency reserve is for per policy that you guys set. It's a structural imbalance that we utilize those funds for that specific reason. So we've had other previous years where sources have been greater than the spend, and that's enabled us to build up our reserves. But just remembering back through many, many years of looking at our reserve levels and the trends that we would expect to see, this is trending like our forecast, has portrayed, which is we're in a state of building reserves, and now we're at that point where our expenditures or our uses are exceeding our revenues, and now we'll start drawing down on those reserves. Everything that we talked about, the major events where Desert is going away, and expenses or services will transition from the CCC to Central Health are happening. So the board, through previous action, has set a tax rate that's enabled us to build up the reserves and to deal with the imbalances that we have both this year, and quite frankly, we anticipate having imbalances next year, but you have the reserves to deal with that. And so, sorry for the long explanation.
No.
It's been a long-term strategy that the board has deployed to build those reserves up. And so this is the events where we're at the high point of our reserves, and they'll start drawing down over the next several years.
And those reserves allow us to take care of those expenses that we've been planning for without cutting services to the individuals that we serve.
Well, you're not only not cutting services, you're expanding services. And so this allows you to expand services, to increase services to patients that need our services.
Great point. Great point. The other thing that I want to go back to is just that the audit that we're budgeting, the performance audit that we're budgeting for, is for a performance audit similar to the one we had 5 years ago. Because we have no idea what the Commissioners Court will eventually determine with regard to how they want to structure a performance audit. What we've budgeted for is what we know. And we know that we have a performance audit every 5 years. And it's not a forensic financial audit. It is a performance audit. Is that correct?
Just one slight technical correction. It's a performance review that we budgeted for, and it was a performance review that we conducted in 2018, and that the financial order requires us to do another performance review, and that's what we've budgeted for. So just a slight change in the technical.
Thank you. I appreciate that wording. Mr. Geisling?
Yes, and so just to put this out there, although to your point, we don't know yet.
No.
Once the County Commissioners Court makes a decision, and right now the prevailing thought is that their procurement department at the county would procure the services for the review. We'll obviously need to see what the scope of that review is, and if it's insufficient, if it does not benchmark us against other healthcare systems or districts, if you will, if it doesn't look at what we're doing in terms of how we're, direct provision. So all these things that we need to be measured on, and I'm just touching on a few things, then we may need to go out and procure additional review services in addition to that, but we don't know that yet. But I wanted to put that out there just for high level awareness. Thank you.
Thank you. All right, I've hogged up all the comment time, so I will go around to members. Manager Motwani.
I don't have any really other any questions outside of just following along with what Mike was sharing. Would that be unbudgeted, if I might ask him directly, would that then be unbudgeted expense if additional services were needing to be procured? Just to be clear.
Well, we would look at the consulting lines and the totality of all the expected consulting contracts, and we may need to come back to you for some additional authority, but we would start there. I just don't know yet.
Thanks.
Again, we don't know what the ask will be. So we have to figure that out first and then determine what needs to be done. Manager Jones.
Just one quick question. Mr. Geeson, you indicated that this would be consistent with the performance will be looking at us in relationship to other healthcare districts or hospital districts. Did I understand you correct?
That is one dimension. That is one area that we would be looked at. Like I said, I was just touching on a few, but we also have noted, hopefully memorialized with the adoption of the resolution, that we'll go back and look at the historical reasons as to why we are where we are. As you pointed out, I know that the performance review also looks at a lot of different organizational aspects about how we operate. And it's very, very thorough.
I guess my question goes to what I raised last time, whether or not they will look at the fact that we are not truly a hospital district in the sense of operating a hospital, and will take under advisement all of those factors that go into operating a hospital versus what we are. That's one point. The other point is, as I mentioned last time, I think that every time we go forth with our budget and we talk about our tax rate, it's important that we emphasize that we do not own and operate a hospital, so that the taxpayers and the elected officials understand that.
Thank you, Manager Jones. Manager Musaki.
Well, thank you. I'm really happy and pleased with the budget, and thank you for all your efforts. And I'm glad that we are planning on providing direct clinical services with the equity lens following our strategic equity plan. So I commend you on all your efforts, and I look forward to providing more care for our underserved population. Thank you.
Thank you, Manager Musaki. Manager Zuniga.
Questions?
Thank you, Manager Zuniga. Manager Greenberg.
No questions. I do want to note that I am very happy to see the direct care that we're providing. Thank you.
Thank you, Manager Greenberg. Manager Brinson.
I apologize if this has already been answered, but the amount of money from the UT affiliation agreement that we are proposing for 2023, is it the same as what we paid in 2022?
So the CCC in 2022, just last month, paid $35 million. And so the way that we're budgeting next year's, we looked at the cash available for the Community Care Collaborative. And there's some remaining cash related to that. We're estimating about $13 million. And we're budgeting the remaining amount in Central Health of $22 million. So it would be the same amount that would be paid, or that's budgeted, I should say, as this year. Just a little different, in a little different place.
Thank you.
Thank you, Manager Brinson. Manager Valadez.
Well, you know, we are including the 35 million for our budget to UT Dell Medical School. And so I noticed, I'm just questioning, asking Dr. Bell for clarification as to when we're going to have a discussion about.
Those will come up after we finish the budget funding. So we will go from budget funding, and then we will go to the budget resolutions.
So we're not going to have this discussion prior to the budget vote. Is that what you're saying?
I'm saying that we're going to vote for the numbers, all right,
sure
that were presented on the screen here. And once we pass those numbers, then we will look at our budget resolution, and we will go through and determine what's needed in the resolution in addition to what is already there and what's not.
Thank you, I got it.
Is that it?
Yeah.
Managers more?
No questions, just a sincere thank you.
Okay. Hearing no further discussion, managers, before we begin voting, I'd like to remind everyone that we all have been advised as needed on our areas of conflict and/or duality of interest. If there are any comments, questions, or concerns about tonight's vote, please reach out to our legal counsel with the County Attorney's Office or our Chief Compliance Officer, Mackenzie Frazier. Now I'm going to turn it over for a second to David so he can outline why we are making so many motions and why they are crafted the way they are.
Thank you, Dr. Bell. Again, David Duncan, Travis County Attorney's Office. My role seems to be apologist this evening. This is largely my doing and the doing of my planning with the staff. When we looked at the budget resolution, is normally integrated with the vote on the budget funding. And when we looked at that and our presentations in the previous weeks and months about how we're going to approach the budget, and that the budget resolution is really the foundational document of the board telling the staff how to spend the money versus putting the money in the budget. So the first vote, what we're calling budget funding, is you're just going to put the money in the budget. And then the second vote, which is a base resolution, a resolution that just pretty much follows the resolutions of years past, adds some things that are new where we're funding the clinics that we're building and things like that. So it mentions a lot of the fundamental things that we thought were just basic to the resolution. And we'll vote on that first, and then we'll start talking about the amendments. And then at the end, we'll vote on an as amended version, which we don't have written because we don't know what it's going to look like. But you will all know which amendments you passed. And we, the management staff here at Central Health working with us, we will work that into a document, and then we will write it around for everyone's signature later this week or early next. And I am available for any questions that you have on that convoluted process.
Okay, any questions for Mr. Duncan before we start? Manager John.
I want to make sure I understand. It's sort of like we're voting to put money into a pot, and each of the individual funding recommendations are putting into that pot those elements that make up the operations of our enterprise. And then having done that, then we will go back and make additional resolutions after we voted on the initial one. Okay.
Correct.
All right.
Absolutely correct.
Is that it, Manager Jones?
Yes, thank you.
Any further questions for Mr. Duncan before we begin our process? Okay. Manager Brinson will provide a motion.
I move that the board approve the budget items in the Central Health fiscal year 2023 budget that pertain to the University of Texas at Austin.
I have a motion on the floor. Do I have a second? I have a second from Manager Musaitis. So I have a motion from Manager Brinson. I have a second from Manager Musaitis. Any further discussion? Hearing none. All in favor, please raise your hand. Okay. And all opposed? And any abstaining? Okay. You guys got that?
What was that count? I'm sorry, David.
Yes. 5 abstentions?
4 and 5.
You want to do it again? Got it? Next time I'll call them out. Yeah, well, I realized it after my first one. It's like, my first one was a dud, so let me see if I can do better. Okay, I'd like a motion from Manager Motwani.
I move that the board approve the budget items in the Central Health fiscal year 2023 budget that pertain to the University of Texas system.
Okay, I have a motion. Do I have a second? I have a motion from Manager Motwani. I have a second from Manager Brinson. Any further discussion? Manager Musaiti?
Yes, Chair. I just want to make the public aware that I do not have a conflict of interest with the University of Texas or UT Austin, but I will be abstaining from this item because of duality of interest, because of issues I've discussed with our legal counsel. Thank you.
Okay. All right. If no further discussion, all in favor, raise your hand and keep your hand raised. Manager Motwani is in favor. Manager Brinson's in favor. I'm in favor. Manager Zamora is in favor. Any opposed? The system? It's the system as opposed to the school. And I don't know what the separation is, so. Okay.
When it comes to Robert's rules, the only thing that matters is the number of members present and voting. If 7 of you abstain and the vote is 2-0, it passes.
It's 2-0. We've had votes like that before.
Okay. Any opposed? And I think I saw none. Any abstaining? I've got Manager Jones abstaining. I've got Manager Musaiti abstaining. I've got Manager Zuniga abstaining. I've got Manager Greenberg abstaining. And I have Manager Valadez abstaining. The motion carries. Okay. Manager Zuniga, may I have a motion, please? Do I have a second?
I second.
I have a second from Manager Greenberg. So I have a motion from Manager Zuniga. I have a second from Manager Greenberg. Any further discussion? Hearing none. All in favor, raise your hand. Manager Motwani, yes. Manager Jones, yes. Manager Musaiti, yes. Manager Zuniga, yes. Manager Greenberg, yes. Manager Brinson, yes. Manager Valadez, yes. Any opposed? Oh, and I'm yes. No opposed. Any abstaining? Manager Zamora. Okay. Manager Valadez, I have a, motion carries. Manager Valadez?
Yes, I move that the board approve the budget items in the Central Health fiscal year 2023 budget that pertain to Sendero Health Plans, Inc.
Okay. Do I have a second?
I second.
I have a motion from Manager Valadez. I have a second from Manager Brinson. Any further discussion? Hearing none. All in favor? Manager Motwani, yes. Manager Jones, yes. Manager Musaiti, yes. Manager Zuniga, yes. Manager Greenberg, yes. Manager Brinson, yes. Manager Valadez, yes. Manager Zamora, yes. Any opposed? Any abstaining? Myself. Okay. I recognize Manager Musaiti for a motion.
Yes, I move that the board approve the budget items in the Central Health fiscal year 2023 budget that pertains to People's Community Clinic.
Okay, I have a motion by Manager Musaiti. If I have a second by Manager Valadez, any further discussion? Manager Musaiti.
I just want to thank People's Community Clinic for their work and efforts they are doing for our community and their outreach. They're doing an amazing job, and especially with the Health Equity Index, they participated, and the big Dr. Celia Neville was a big component, part of that. So want to commend their efforts and thank them. Thank you.
Okay, thank you very much, Manager Musaiti. Any further discussion? Hearing none. All in favor? Manager Matwani, yes. Manager Jones, yes. Manager Musaiti, yes. Manager Zuniga, yes. Manager Greenberg, yes. Manager Brinson, yes. Manager Valadez, yes. And Manager Zamora, yes. Any opposed? None. I abstain. And just for the record, I abstain on Sendero Health Plans because I'm on their board. I abstain on People's Clinic because I'm also on their board. Finally, Manager Jones, I recognize you for a motion.
I move that the board approve the Central Health fiscal year 2023 budget as presented by staff for all items other than those items related to the University of Texas at Austin, the University of Texas System, Integral Care, Project Access, People's Community Clinic, and Sendero Health Plans, Inc.
I have a motion. Do I have a second?
Second.
I have a motion from Manager Jones. I have a second from Manager Valadez. Any further discussion? Hearing none. All in favor? Aye. That is unanimous. Motion carries. Okay, we will now vote on the budget resolution. Managers, you have documents in front of you. The first document is the base resolution, or the resolution that you were sent by email that has not changed from when we initially sent this to you in February. That's rain, by the way, in case. We haven't heard it in a long time. That's right. That's right. We haven't heard it in a long time, so I know it scares us, but it is just rain. And so we will be I will be asking for a motion to move this document as it is written. I recognize Manager Greenberg for a motion.
I move that the board approve the budget resolution that was provided to the board via email.
I have a motion and I have a second. I have a motion from Manager Greenberg. I have a second from Manager Musaiti. Any further discussion? Hearing none. All in favor? Aye. Any opposed? And any abstaining? I have one abstention, Manager Valadez. Two. Manager Valadez and Manager Jones, and the motion carries. Okay. We will now take what we hope to be the simplest amendment first, which is amendment number 3. And I recognize Manager Musaiti for a motion.
Thank you, Chair. I move that the board approve Amendment 3 to the budget resolution relating to cancer screening.
I have a motion on the table. Do I have a second? I have a motion by Manager Musaiti. I have a second by Manager Valadez. Any further discussion? And I would like, before I recognize you, to say that from how I understand this motion is to look at cancer care and how it is actually being provided to our patient population. And then how, as we go forward with our health equity plan, build on that system and hopefully enhance what our patients receive with regard to cancer screening, diagnosis, and treatment. Manager Musaitis.
Thank you. I think you've encompassed that very well. I think for our population, we don't know how cancer care is delivered and how cancer care is for our population. So I think this is a very critical issue that we need to understand the baseline where we're at. In addition to that, it outlines in our strategic planning, equity plan, a significant need for this area. So that's really the essence of this amendment. It's what it entails. So that's what thank you.
Thank you, Manager Musaitis. Any further discussion? Hearing none. All in favor? Any opposed? Any abstaining? The motion unanimously passes. Okay. We will now pick up on amendment number 4, which is in your packet. And I recognize Manager Valadez for a motion.
I move that the board approve amendment number 4 to the budget resolution related to conducting a performance review.
Okay, and I have a motion from Manager Valadez. I have a second from Manager Musaitis. Any further discussion? I would like to ask Mr. Giesland to explain this particular amendment.
Yes, members, as noted earlier, what this amendment does is it highlights that we will include major past events, conditions, and circumstances that have influenced the strategic direction of the healthcare district and what brings us here today. And it's very much in line and attempts to capture the essence of what Manager Jones has brought forward and others as well on the board over time. Second, this same information will also be used for the benefit of our upcoming healthcare equity, operational, and financial sustainability plan that will be conducted pursuant to the funds in the budget.
Thank you, Mr. Giesland. Any further questions? Manager Valadez?
Just that the clarification that you made earlier is for us to note here that if, depending on what the county commissioners vote on the language that is adopted, then they have to hear from you as we come back to the board for us to address budget amendment or vote.
Yes,
to
some way,
accomplish that.
somehow, we will
Yes.
get this information.
That's right. Thank
That's
you.
what this says.
Thank you, Manager Valadez. Hearing no further discussion, all in favor? Aye. Any opposed? Any abstaining? The motion carries unanimously. Okay. Manager, we will now be taking up amendment number 2 in your packet. And I recognize Manager Jones for a motion.
I move that the board approve amendment number 2 to the budget resolution relating to funding in support of the Black Men's Clinic.
I have a motion by Manager Jones. I have a second by Manager Valadez. Any further discussion?
I don't quite understand, I'm sorry.
No. Manager Zuniga.
I don't understand what personal costs will be concurrent with agreements between, I don't quite understand that language.
I got it.
Okay.
All right. What we are looking to do, which is why I asked the question to community care with regard to how many patients are they seeing in the Black Men's Clinic? And their answer was a handful. So in essence, outreach needs to be done to let the population know that they have access at the Black Men's Clinic. So community care has a collaborative with the Black Men's Health Clinic. And so this motion or this amendment is looking at telling community care to increase the amount of outreach that's associated with men of color and work through that collaborative to increase the numbers that they're seeing in that clinic. And there's additional wording in there that says, not only is it men of color, but it's also looking at individuals that are of the same age and population and race that are in our areas of health equity, where we have noticed that there are gaps. And those individuals would also be targeted toward those outreach and sent. Now, nobody's forcing them to go to the Black Men's Clinic. It's not, that's not what we do, okay? But because the main source or the main target of the outreach is men of color that are within a particular age, that is the population that the Black Men's Health Clinic targets. And so that's what that amendment is attempting to do. I'll turn it over to Mr. Jones for any additional.
In addition to what we said earlier, the goal is to be able to build the capacity within community care by increasing the number of men of color, focusing on African-American men, but all men of color, to be able to be seen there. It does us no good to have them providing services and nobody shows up, which is usually the case for a variety of reasons. So these dollars will be focused to the Black Men's Clinic, Health Clinic, to be able to recruit, educate, screen, test, and build upon that capacity there this year. And it is our intention, based upon what we see this year, is to revisit this again next year and the year after as we build that capacity.
Manager Brinson and then Manager Valadez.
So their ask was for 240,000, and our resolution here, our amendment would be 165,000, and the difference is to be made up by community care?
No. What we're saying is we're committing that. We want to see what that does. If that needs to be increased, he said, it comes back and we will increase that. There's a certain amount of startup time, hiring time, et cetera, So we want to watch that and we want to look at, if it is successful, we want to increase that in the future. Manager Valadez.
Yes, as I brought up initially when we first heard this, we were meeting over at AISD and we began talking about this. One of the concerns I had, or even, yes, I think that's where it was. One of the concerns I had is that Latinos, just like other populations or males in Travis County, may not necessarily be called African American. And so I just wanted to make sure that the distinction is really of it's really there to highlight the fact that Black males have systemically been excluded and marginalized from the population, but so have others. And we want to make sure that however they're culturally, their outreach teams are culturally and linguistically sensitive or appropriate as staff people for conducting that service, for reaching out into the community and making sure they come in. So the staff will be in addressing the needs of of those different populations. Because I totally agree that the issue is for males. It's targeted towards males who tend not to want to receive services. And males, like in most of the populations I know of, regardless of what color they are or ethnicity or anything else, tend to work many more hours, especially in this economic time period, because they are not accessing resources. They're having to overcome economic hardships as a result of the pandemic and what is happening in the market and in society. So I just want to make sure that we understand that it's for all males, but especially highlighting, again, African American, but it's for all males. And that should be regardless of the language that they speak, because as we heard Jason Fournier say today, you know, a vast majority of population receiving services doesn't even speak the English language. And that's also, I think, what we need to address and incorporate. And my question, Dr. Bell, is whether or not there's an ability to change that amount of money to the full amount that the ask was for, I think it was 240,
290, I think.
$290,000. I wanted to know whether or not we could make that the motion for that specific amount. And I can tell you right now, if all our staff, our expert staff at Central Health and Community Care do their jobs, I'm sure that clinic will be full of men trying to access care. I can promise you that. And if nothing else, I'll go pick them up and take them. But I just want to make sure that they start out with the ability to fund that clinic and hire the staff that they need to have in place to be able to do what it is that they're telling us to do. And if their ask was originally 290, we want to only give them 140,000. That's half the dollars. I don't want to handicap them at the onset. I think that we should consider the full ask. And that's what I'm asking.
And I will come back to you.
I appreciate that.
Manager Jones?
The full ask was $290, $290,000.
90,000, right.
The goal was to be able to get to that within the year based upon startup and build up.
I get it.
Now, the question is whether or not resources available via community care to be able to do that. 165, I was assured that we would be able to start off with and then build upon that capacity, and that's the intention. And one other caveat, I want to make sure we're clear here. This will be dollars that will be basically passed through, so to speak, or work in concert with community care, but to the Black Men's Health Clinic. So they would be the ones who are hiring and doing the outreach work and the advocacy, those kinds of things. So that's where the dollars I envision going. So I want to make sure, as I asked last time, is that's the understanding so that we don't have a misunderstanding once we vote on this that, well, no, community care is going to be doing it on behalf of them. No, this is money that community care will be having that will go to them to provide the services, the outreach service.
Mr. Geisler, did you want to address that, please?
So if I understand your question correctly, is community care just simply a pass-through conduit? Let me rephrase that.
Well, pass through in the sense that the funding would go as part of the other work that they're doing with the Black Men's Health Clinic to provide services. But in this case, in order to build up that capacity, those dollars would be made available to the Black Men's Clinic to be able to go out into the community and do the outreach to get those clients in.
That would be, and I'm advised that, and this was earlier this week, that there is work underway to get a services agreement, and I might not be using the correct term, or a contract or use agreement with the Black Men's Clinic, but it would be up to community care to determine who it is that they work with and whether it's in-house staff that are hired as community care employees, or if they work with a particular community group to have the outreach or to rebuild trust. And so as far as, does this signal that this is a direct pass-through and that there's an agreement for $165,000 between community care and the Black Men's Clinic? That's not what this says. So it would be up to community care to determine, working with the Black Men's Clinic, that's, in other words, concurrent with agreements between community care and the Black Men's Clinic, what's the most efficacious way to put together the most culturally affirming outreach to encourage men to seek care if they've never sought care before, really focusing on that population, but as well as keeping men engaged in care that have sought out care. So that's, when I read this technically, that's how it would work.
But in operational terms, we would actually get, I think the last part of that amendment outlines that the funding of personnel costs will be concurrent with agreements between Community Care and the Black Men's Clinic as detailed in a prospective engagement plan that will be presented to the Central Health Board of Managers by Community Care by the end of the first quarter of fiscal year 2023 or not soon. So in essence, we would know what that arrangement would be and why Community Care feels like that's the most effective arrangement in being able to assist outreach to increase those particular visits to the Black Men's Health Clinic.
Okay, I appreciate that. I guess my question was at our last meeting, I raised the question specifically is that we'll use this time to make sure we're clear, because it was my intent with this is to be able to have those dollars available to hire staff by the clinic to do this work. What I'm hearing now, and correct me if I'm wrong, is that the Community Care will work out something with the Black Men's Health Clinic to ensure that persons who are recruiting people to their clinic will be culturally relevant and the like. And my only question regarding to that is, in so doing, what does the Black Men's Health Clinic becomes other than a repository of Central Health, picking up clients that they're seeing, they're recruiting, they're outreaching to, and bringing to the Black Men's Clinics to be seen by them. I don't see where the Black Men's Health Clinic is actually engaged in its own effort to do this. And that's the concern I have with this.
Understand, Manager Validin.
And I'm a cheerleader for that thought. You know, when Latino Healthcare Forum was put together, it was put together specifically to reach out to a community that had been heretofore completely ignored. And that is hard to reach Spanish-speaking Latinos. It's like pulling teeth. You have to visit them 7, 8 times just to get them to understand the concept of accessing resources that are actually available to you, because they don't think that anything is available to them and no one is ever going to listen to them. You have to have very hardcore, compassionate, and committed staff people that you can hire, that you can bring to the table, that work in those communities that you may never see. You may not see unless you're sitting in a black communities meeting and understanding what it took for them to get there. And that's just the cultural component of it. And if we're talking about expanding it to include males from other ethnicities or languages, well, you know, then you're running into double and triple the effort just to get out there and do the initial meets. That is a lot of work, Mike. It really is. And once you get it going, you know, then that you may see the dollar, I mean, the emphasis change from less outreach to providing surround services or wraparound services to get them into the clinic and maintain them. I think that once they get into the daggone clinic, they're not going to leave. They're going to stay there. And they're going to, that word of mouth from the very people who are receiving those services is going to be what you need in order for them to anchor that clinic for Black men, men of color, men of ethnicities, men of other languages. And it isn't going to happen. It hadn't happened yet. We hadn't reached equity yet. So how can we ask a group, an entity, which we fund, just like looking at ourselves in the mirror, and honestly expect them to succeed at the onset? They're going to be having to overcome such barriers that they need to have their money and they need to be able to be the decision makers, at least at the onset, to get it going. It's very difficult for them to expect community care staff, just like Central Health staff, to go out and do the job. We're used to doing things a certain way, the Central Health way or the community care way. Well, this needs to be done a Black man's way. This needs to be done a Latino way. This needs to be something else. And I'm serious. This is, I really do believe that if we don't give them their money and allow them at the decision-making table to decide what staff they need, they're not going to, they're going to fail. They're going to be set up to fail. And I don't want them to do that, especially since we're going to be holding this as a model, holding this up as a model for the rest of the United States, or at least the rest of the backwards Texas, you know, that has historically dealt with systemic racism.
Okay.
And
thank you. I appreciate it. One of the reasons that this route was taken is because we wanted to get it done this fiscal year. We have a contract with Community Care. We do not have a contract with the Black Men's Health Clinic. And so there are funding opportunities where the Black Men Health Clinic can apply for additional services, for outreach, or other programming that they think is important that fits with Manager Valadez's vision of calling the shots. Okay, but to have an increase in the number of individuals that are accessing the services this year, in this fiscal year, it's more advantageous for us to go through an entity that we have a contract with, to be able to work with them, which they're doing now, to provide those services, to see how best to provide outreach. Now, I think I heard Mike say, but don't let me put words in your mouth, if the Black Men's Health Clinic says that we have this organization who has done an extreme amount of outreach to the young men's community within Travis County, then Community Care could contract with them, and that entity would end up doing the outreach and bringing individuals into the Black Men's Health Clinic. While at the same time, the Black Men's Health Clinic can be applying, I think it's $800,000 that we have as funding that they could apply for and add on services that are in addition to those outreach services that we're trying to provide at this point in time. That would be a direct contract. That would be monies going directly to the Black Men's Health Clinic.
I hear what you're saying, Chair. I'm just saying is that we have to do something this year.
That's right.
And if what I'm hearing you saying, the only way we can do something this year is to be able to develop a arrangement in which Community Care would hire, as if I'm understanding you, I want to make sure I'm understanding you is right, hire these folks and assign them to the Black Men's Health Clinic for the operations.
That's an option.
Oh, that's one option, okay. Then my question is then, to what degree will the staff at the Black Men's Health Clinic has overall oversight for where they go, how they do, and how do they get to the communities that they, the Black Men's Clinic, deems as important versus what Community Care deems as important?
I would think in the same way that they utilize their services for primary care, because in essence, there are some defined efforts that you want to target that particular population. I don't think that, you know, I don't mean this as being flippant, but they don't send a women's health provider to the Black Men's Health Clinic. They try to tailor the actual provider and the provision of those services toward that population. The Black Men's Health Clinic should advise and should collaborate on that to make sure that that happens. That would be our expectation going through, and that's what we would sort of look at when this detailed perspective is given to us with regard to how they're going to make it happen.
And I agree, but the reason, to use your same analogy, is the reason we find ourselves in this point, at this point in time and date, is because we've had community care. Nothing's wrong with community care. I have a lot of faith and respect for what they've done, but they obviously have not got this population.
That's correct.
And so the question is, here's an opportunity in which we can make resources available to an organization here that could do that. I'm still not understanding the legal problem, why that contract cannot be between the two, but I'm not going to spend a lot of time here tonight because it's probably a legal question. I'm just saying, if we have to go the route that we're talking about, then I still think that we can put in the directives to community care. The board expects that staff that would be assigned there would be under the auspices, direction, and oversight of the Men's Health Clinic to ensure that outreach in those communities are done in a culturally appropriate and effective way.
I hear you.
Some directions to that.
Mike?
Yes, members, and that's with the language, and this was based on the email communication that you sent to me. So taking that as the guidepost, trying to form this and saying concurrent with the agreements between Community Care and Black Men's Clinic. And so in terms of how the staff, how their day-to-day work schedules look, what events they go to, how they interact with individuals who are not patients versus those who are. I mean, I'm just encouraged to just think about the gamut of things that you could do for patient engagement and health empowerment. That obviously is going to have to be done in conjunction or concurrent with the agreements between Community Care and Black Men's Clinic. Now, the operable phrase in there is that there is an agreement somewhere that it says Community Care and Black Men's Clinic need to have an agreement that spells this out. The second thing that will give this board line of sight, and quite frankly, the community transparency into, okay, how are you going to go about doing this, is that by the end of the first quarter of this fiscal year, which is the end of December, so that's not that far away, you have an engagement plan presented to the Central Health Board of Managers. So it's not something that gets developed, kind of off to the side and then it gets lost on a shelf somewhere. It comes back here, has to be posted as an agenda item, and you have the opportunity to engage and ask questions relative to that agreement that's referenced in the sentence right before it. How is it that we are going to do, Manager Jones laid out the questions perfectly. How are you going to accomplish this? And so you have the opportunity to have that conversation and that input. Now, if that plan comes back and it's not acceptable, then there's enough space in here to say, come back with a more acceptable plan.
Manager Valadez.
One of the things that you have to remember, and I want to use Latino Health Reform because that's dealing with a similar population. It was very hard to get started. We didn't get funded initially, but we had our community advisory board. We remained focused. We were trained by our own, who went out and got training from the disparity study. They went to Harvard, they went to Boston, they got named as #1 nonprofit for closing disparities gaps in the United States. They won that award, but they did it amongst themselves. Okay, and I'm very glad that I got that experience. And I do know that because you have a community advisory committee that is committed, medical professionals who are committed to making sure that this is a success, I don't want them to be handicapped by only getting half of what they're asking for when they're professionals, Mike, and they know what they need.
This is a board consideration. This isn't.
I understand.
This isn't my call.
I understand, sir, but you're my.
And as an advocate and an ally, I will tell you, there's so much more that needs to be done in this arena than legal what we're talking about here.
There is, but in order for them to get started.
So you need to direct that to your fellow board members.
I appreciate that. So fellow board members, understand that we're talking about financial limitations when you're cutting their asking budget in half. I mean, budgets, okay? You know that you're in Lone Star. You know what that's going to do to you. I just don't want them to be handicapped. I want them to be successful. I want them to be working with their communities, not only of color, but ethnicity and language. And I know that that's going to take a lot. And if we want them to get off the ground, you have a Sunday clinic, and you might get 1 million people there. You have a good outreach team, which is going to be what they're going to have to concentrate on initially to get people to understand that this exists. Are we going to be supporting that? Because if we're going to cut their budget, then let Central Health pick up the marketing costs. Let us pick up the outreach costs. Let's pick up the training costs. And they tell us who their trainers are going to be. I mean, that's my suggestion.
Okay, thank you. Manager Musaitis, Manager Jones, and then Manager Motwani.
Thank you. I'm glad we're highlighting the importance of disparities among certain populations, which is, it really boils down to decades of issues going back to Tuskegee. Well, the trials, the mistrust within this the mistrust in among this population, and we know based on the data that African American men tend to have higher disparities compared to other men because a lack of trust of the healthcare system we have in place. Now, with that said, I support an outreach for men, especially men of color, at every community health center that we have. Because in terms of, I think one thing that outlined today during our presentation, Jason said one of various transportation, I believe. So what would happen to an African-American male or a person of color who lives in Jonestown? Can they access this men's clinic? So there will be additional barriers. And also in terms of bringing items to our board, I would perhaps prefer us to have a streamlined process of vetting these issues beforehand, and so we can make the best decisions for our community and for our organization, because definitely we need to address the disparities within our community. So that is really the concern that I have, is that this was not vetted very properly. It did not go through the proper channels, but yet I support an outreach that is not specifically to the Black Men's Clinic, but yet to all the clinics that provide care for this marginalized, I don't want to really call it, for this population that is in dire need of many services. Thank you.
Thank you for managing Musaitis. Manager Jones.
We just voted to support cancer research without a vetting process.
That's right.
The point is that this service is a service that focuses in on the population that has the lowest life expectancy. It's not like we're just talking about anybody. And so there is a need in the community. And what we constantly hear over and over again is why we can do it for him, why we can do it for this population or this population. But when it comes to serving men of color, particularly Black men, which this country has a whole history of, all of a sudden we have to do a vetting process that we don't require of others. So it frustrates me that here we are, 2022, going through what all we've gone through for these many, many years and months, and here we are in this boardroom in Austin, Texas, still having some of the same discussion. So I suggest, I'm putting forth that we vote it up or down. I think it should be put forth, and I think it should be funded. If the board chooses not to, then that's fine. They have the right to do that. But what I'm hearing now is our rationalization why we should not be funding a service for a critical population in our community. And that frustrates me very much so.
Okay, I will let Manager Motwani. Back to you,
Thank you, Chair. I have a question. Would the just in this, a point and shoot answer would be great if you're able to answer, Chair, or if you call on Mike. Would the we're discussing the hiring of staff, particularly. And would those staff be, I mean, just to get this clear in my head, would those staff be community care staff or Black Men's Clinic staff?
How is this envisioned? Would they be FTEs of community care?
Right.
Or, you know, or would those configurations be malleable in as much as the way we're viewing this? Or is that contingent upon whatever agreement is there?
They could
Between-
be employees of community care, or it could be contingent upon the agreement.
So there could be an agreement, so contingent upon existing agreement when we say concurrent, or?
And you'll see that agreement when they bring back the engagement plan by the end of the first quarter.
Okay, so that agreement is
The end of this calendar.
TBD, or is that an existing agreement? Do we?
I am not advised. That's something that I think they would need to work out with the Black Men's Clinic.
Right.
Okay, so there
hinges on that.
It seems like there is
has to
that
be some
opportunity.
agreement that there's services being provided in the clinic.
Mhm.
And we know that those services, we can pay for outreach services under that contract with community care.
Got it. Okay, so that helps. So now for I think a bit of the passionate opinion. You know, hearing the speakers speak today got to me at a place where I'm very vulnerable, and I harbor a very similar discomfort and, you know, for lack of a better word, mistrust very often of our medical care systems. And it's ironic, especially given that folks of my ethnicity are often overrepresented, especially in the practitioner field. And it's also not ironic given that culturally, you know, I'm raised in a culture where herbal medicine and, you know, your food is your medicine is sort of, you know, so stay away from clinical interventions as much as possible is also part, you know, intrinsic part of the culture. In any case, I'm very often not comfortable in the healthcare space, in the traditional healthcare space. And for me, hearing the speakers, I wanted to go to this clinic. For some reason, it just felt like a safer space for me. And I think that speaks to the importance, and again, this is one opinion, but we're hearing an opinion that's echoing dozens of opinions that were represented by the many folks here. I feel like having that space provisioned and really enabled to grow or to be seated in a place where it's built for success, which is why I really appreciate the partnership with community care. But to be able to grow organically with that community support, I just think it's really important to have it there. I mean, and have it be a part of maybe all of the other community health centers as the Black Men's Clinic, because I view it as a safe space in so many ways. And we don't discuss men and vulnerability a lot and looking for a safe space, but when it comes to healthcare, it's a thing. And I don't mean by any means to overshadow the disparities that Black women are facing, which are, you know, horrendous when we're looking at maternal mortality. And I don't even think we know what we can scratch the surface of the disparities in care for Black men, because I don't think we're seeing Black men in clinics to be able to measure that enough. And that being said, I would love to be able to see language that, of course, allocates this 165 amount and closes that daylight with the 125, perhaps just saying, I don't know how we do it, if it's possible, but if we could find a way to just make the language say that 165 is allocated and the other 125 perhaps is provisioned somehow for availability contingent upon achieving milestones as defined in an agreement that we'll see. But so if we see an agreement and it's successful, I'd love to know that dollars are provisioned to encourage future success within the same fiscal year. Does that make sense?
Yes, it does. Manager Musaiti. Were you finished?
Thank you.
Okay.
Thanks, Chair. Yes.
You know, it really disheartens me when someone talks about race and they don't really realize who they're talking to.
my color, the way how I represent, so, and a person who faces inequities everywhere I go, and the racial discrimination that I also go through, and people like me that I do not understand what others do. So it's really disheartens me, that comment that manager you've stated. Thank you.
Thank you, Manager Musaiti. Parliamentary question, David. Can I accept a motion to amend the amount of the amendment and then have that voted on and then vote on the amendment, whether that if it doesn't pass, of course, it doesn't change. If it passes, it increases the amount that's within the amendment.
That's exactly how it would work, yes.
Okay. So.
And there have been 2 amendments offered, neither of them have been accepted, but that's all I can say.
Yeah, I know the 2 that you're talking about. Manager Greenberg.
Okay, I am now confused, and I readily admit it. Manager Jones put forth an amendment that I think had $169,000 in it. It's 165. I'm not looking at 165,000. Is that correct, Manager Jones?
Correct.
And so is that that's the motion you put forward? Is that the motion that you wanted?
The motion was for the 165 to be contracted with or arranged through community care with the Black Men's Health Clinic.
Right.
Yes.
Okay. And I thought also that as part of your motion or an explanation, you said 165, but then if they're using that, come back to this board for more. Is that correct?
That's correct, yes.
And so that was your motion and the motion, obviously, that you were in favor of, that you presented,
yes,
right?
Yes.
Okay.
That's correct. And he doesn't have to accept any amendments to his.
Okay. Okay. I just want to make sure that I
we can vote
understood
down.
my colleague on the board correctly.
You got it.
Okay.
You got it.
All right.
And what was acceptable to the clinic, correct? The 165. The 165, the Black Men's Clinic was acceptable.
I don't know whether it's acceptable.
I have discussed it with it as a beginning phase. This is what we indicated we would ask for, with the understanding we come back for the additional one.
There you go.
So,
perfect. Thank you for that explanation. Thank you.
Well, if I may, I understand that people just want a reassurance that we're not, because if you don't write it down, in my world, it didn't happen.
That's right.
And so if we don't write down that our intention is to give them the full amount, but we're going to start with the one, like just make it more sealed in concrete, I think people maybe could accept that.
Thank you.
So, Manager Valadez, do you have a motion to increase the amount from 165 to 290? And just for full disclosure, all right, I've been presented with the funding request. The 290 includes 2 outreach coordinators and a grant writer. Manager Greenberg.
I have a question for my colleague, Manager Brinson. So it sounded to me like what you were proposing was to clarify the intent in what Manager Jones had, right?
Yes.
And so how would you clarify that intent?
Well,
What did you hear?
Yeah.
Well, what I heard was that he wants us to reassure the Black Men's Clinic and ourselves that our intention, if they do well, if they meet these measurements that they will probably provide us.
That's correct.
Then if they do that, then we will release the other monies.
So are you proposing that as some amendment language to what Manager Jones proposed?
Yes.
Manager Zuniga.
Having appropriate metrics isn't in here, and it's what we've been getting in trouble with. Right? like metrics, don't ever, I'd hate for us to make the same mistake, knowing we want to make the whole thing, but then we don't have any metrics, and then we have to go back and get metrics, right? And that we're always dealing with.
Yes.
So if there's, I agree that we do want everyone to feel comfortable that they're going to come back, but is it saying it in an open forum enough for us to say it is not enough, and you think it's not enough for us to say?
Manager, I understand what you're saying, Manager Matwani.
Yeah, I can certainly appreciate concerns around metrics. I don't know that now, I mean, there are a billion times we could bring that up, and this is one of the times where I think we can leave it up to community care and the clinic to sort out those metrics and put them into an agreement. Community care and the clinic can determine the release, the tranche release segments or schedule. Release is even, I don't even like that word, but you know what I mean. And excuse me?
Cash
Yes,
flow.
thank you, thank you. And I think that, you know, these particular, I think there's a freight train of historical context for me that really makes a lot of the considerations that might be intrinsic barriers to this happening. There's a freight train of historical context that just runs over them for me. Thank you.
Thank you, Manager Matwani. Manager Valadez.
Well, I'm one of those.
I
Thank you very much, Dr. Bell. I'm one of those that believes there was, thank you, Cynthia. We're Tocayas for a reason. So if it's not embedded in stone, it's not memorialized. And I have been witness to this historic fact time and time again. And so I would prefer to err on the side of the original ask, than on trying to figure out, we're only going to give them 165,000 right now, and try and figure out what that's actually going to fund. So for me, I would like to make a motion that we give them that we allocate in our budget the $290,000, and that between the Black Men's Clinic, their advisory board, and community care, that they work out the plans for how that is going to be allotted, and the metrics that they will use to achieve that.
And David?
Whatever the board does with whatever amount of money will have to meet the Constitution.
That's correct.
To be a grant-making organization in Texas requires very specific statutory authority, and we do not have that.
That's correct.
Any funds that are allotted, the expenditure's predominant purpose must accomplish a public purpose within the framework of the government organization. The government organization must maintain sufficient control over the expenditure to ensure that it accomplishes the public purpose and does not benefit private parties. And the government, the arrangement, whatever the structure that is put on the expenditure, has to provide a clear public benefit in return. So you can't just give somebody money. That's just constitutional 101.
Let me finish. Okay. What I would like to say is the amendment as written, does it meet that standard that you just outlined?
It does, because of the language that Mike was highlighting, that they have to bring us a plan, an engagement plan, and the engagement plan is going to have to meet this structure.
So I'll recognize you when I finish.
Yes, thank you very much.
If we increased the number amount, does that change the standard of the amendment?
Immaterial.
Immaterial. Okay, thank you very much. Manager Valadez.
So then I would like to amend, or I'd like to offer this motion. that we just amend the allocation of 165,000 to 290,000. That's it.
Okay,
The rest of it can get worked out as included here.
I have a motion to amend the amendment that's before us
Amendment 2.
to increase the number amount from 165 to 290. Okay, do I have a second? I have a second from Dr. Zamora. So I have a motion from Manager Valadez. I have a second from Dr. Zamora. This amendment increases the number that you see within your amendment from 165 to $290,000. Okay. Any further discussion of the amendment to the amendment? Manager Greenberg.
So I have a question for Manager Jones because he made the original motion and said that he had discussions with community care and with the Black Men's Clinic and had arrived at that amount. And so this is a big difference from what you first, from what was in the motion that you put before us.
Yes, but it's consistent with what I had put forth before, is that the intent was to go to 290. What Manager Valadez's amendment does is do that with specifications of how do we validate legally that we've spent the money appropriately, that meets all of the.
Right, I understand the law that we have to
So, yeah.
adhere to the Constitution. They have to come back with a plan or it's not constitutional. Okay.
Right,
All right.
so this goes to the original plan.
Now I get it.
Yes.
I'm so sorry.
Okay.
I did not
Now you get it.
I get it now. I'm sorry,
Okay.
it took 4 times.
I
finally.
unless you've
very sorry.
endured a lot of what I did in my life with Texas statutes, it's obtuse. Okay, thank you.
Okay, thank you. Are you clear, Manager Greenberg? Manager Zuniga?
So sorry.
Got it.
Yes, I did.
Oh, no.
Yeah, that's what I was gonna say. If we vote on it, it just becomes added. Yeah. Okay, so I already have a motion on the table. I have a second. We've discussed, I hope, increasing.
Okay, which increases the amount, but nothing else.
You're voting on the amendment to the amendment,
Okay.
okay?
I've
All right.
only been in meetings for 10 hours today.
I know. I'm almost there myself. Okay. All in favor of the motion of the amendment that's on the table to amend the amount from 165 to $290,000. All in favor, say aye.
Aye.
Okay. I've got everyone except one. Any opposed? I have no opposition. Any abstaining? I have one abstention. Okay, motion carries. So the amendment has been amended to the amount of $290,000. Okay, now I want to vote on the amendment. Okay? Got it?
I
All
swear
right.
to God, you used amendment like 17 different ways, but I got it. I know where we are.
Good.
We're going to substitute motion.
Well, hey.
Keep on going.
All right. So I have a motion on the table and a second. All in favor of amendment number 2 as amended by the previous vote, say aye.
Aye.
All opposed? All abstaining? Okay, so I have, did you vote aye, sir? Okay.
He was my second.
Okay, so I have all yays, 1 abstention, motion carries. Okay, the amendment is adopted.
Thank you.
Thank you very much, board members. On behalf,
I'm hoping that
I said,
your proposal was the most complicated proposal. I'm worried about, we're really gonna get into some deep water on these, but, okay.
Hold on. You gonna say something?
I was thanking the board for supporting that.
Oh, thank you, board.
Thank you, Manager Jones. for
Appreciate
bringing it up.
All right.
Okay.
I recognize Manager Brinson for a motion.
I move that the board approve Amendment 1, Version 2 to the budget resolution related to Dow Medical School funding and reporting.
Okay, do I have a second? Okay, I have a motion by Manager Brinson. I have a second by Manager Musaitis. Any discussion? And I'd like to start off with, you have a version 1 of the amendment. That was what we talked about earlier, like previous meeting. We had a number of comments that felt that we needed to give more time to the process and allow the process to be put in place so we can see that the data that the matrix provides, determine as a board if that information is really something that we feel is responsive to us. And then if that's not the case, we will look to the agreement at some point for enforcement of remedies. That's what version 2 does. It spells that out more than version 1. Okay? Any discussion? Manager Balance.
Okay, so that, where's mine? I have it actually right here. So I'm looking specifically at the 6 categories of permitted investments. Is that the 6 categories of permitted investments, which was?
That was
a couple of meetings ago?
No, it was just last meeting.
Okay.
And it was the pages that you tried to edit, and I told you, you can't edit those because they're in the agreement.
That's right.
That's where those
I
are.
got it.
All right.
Okay, and then the reasoning behind beginning January 31st, which I understand, but ending January 31st of 2024. So just because this is we're talking about a fiscal budget, is that the only, but this is a calendar year. And so I'm trying to understand what was the justification for those dates.
I will take a stab at this and then I'll let Mr. Giesland sort of follow me. The reason that the dates are January 23 and January 24 is because we want to collect the data from the matrix that's developed with UT and see what that looks like. And we want to do it twice, because if the first one comes and we say, that's not really what we want to tweak it some more, then they get to go back, collect additional information, it comes back again. And if we're satisfied, then we have enough time to take any action that we need before a payment goes out.
Then my follow-up to that, Dr. Bell, is I don't want them to give us an annual report when we haven't received anything from them before. And so when you say in this, with specific reporting elements and intervals in accordance with the agendas of the Board of Managers meetings, well, we meet once a month. So does that mean once a month they are going to be providing us with information?
No.
Okay, so then what is the purpose of that statement?
Well, the totality of 4, let's take the entire section, is to avoid exactly what you just said, which is there is one report and there might be additional follow-up discussions and dialogue that the board needs to make a good decision and ensure accountability of the funding. And so it stretches everything out starting January 31, 2023 through 24 for a full year. And where it says with specific reporting elements, meaning what's in the report, and intervals. So it could be a monthly board meeting, a strategic planning committee meeting, could be a special called meeting. But it's to show that this information comes in intervals. It's not just a drop off on the front steps and then everybody rides away and we're done with it. So it's it's designed to give the board as much flexibility as possible, but more important, and it strikes management, this is what you expect to happen.
And the enforcement remedies, what are they,
They're in the contract.
does it, I haven't looked at the contract within the last couple of months.
And I understand
wanted
that.
to make sure that we have the ability to withhold dollars.
Yes, there is a provision in there that talks about withholding.
And does it have a specific amount based on something?
I think it does. I don't.
There are
quantifiable
what I would ask, there are a number of remedies and provisions to ensure accountability for the 35 million and also providing services. I would ask that perhaps you seek legal counsel and executive session so that way publicly individuals cannot assign an interpretation by the board because it's been expressed in open meeting.
That's correct.
So do we need to go into executive session to have this?
If you have specific
discussion?
questions on the enforcement remedies, I would say though that we actually have
Well, we have
another
time
briefing,
to be able to look at those.
that we need to
All
get
right,
in
the
front of
vote
tonight.
today.
I get that.
Members, if I may,
I'm sorry.
it would take a considerable amount of time to put together the proper
I get it.
briefing that's in the affiliation agreement.
Totally.
And we just can't do that in a quick recess of 10 minutes.
What I just wanted to make sure is that we have remedies, we have options, and we're not put back in the same position that we've been in for all these years. That's what I just want to make sure, that we've got accountability language.
I think we have accountability language, and I also think that we are trying to develop a relationship with the University of Texas to be able to get this done on a collegial basis, but we know what the contract would allow if that doesn't happen.
Okay, the only concerns that I have is being a member of this board since 2015 and arguing that point before I got on the board. I just don't know whether or not we are going to truly be able to expect the system, including the medical school, to respond when in fact they have yet to respond appropriately. And I think that's what basically took us to the point of asking the questions to Dr. George McConey's and Amy, Dr. Amy Young, when they were here. And it's their history and their practice of not providing information to us as we have asked for in the past. And I know I myself personally have asked for to the ire of some people, but I continue to ask for it. And it's hard, you want to talk about trust? You want to talk about good faith? I just wanted to bring that up.
Duly noted, Manager Valdez, and like I said before, the budget resolution is a foundational document.
Yes, sir.
that
I
establishes the
agree.
intent of the will of the board.
Okay, thank you.
Thank you, Manager Valdez. Manager Inside.
Well, there's a lot to talk about this item. First of all, I'm going to start with where we're at right now and given in light of the pandemic. And I personally do not think our community would have been able to combat this pandemic without having a medical school present. And we value their presence and everything they have done for our community. I know their commitment to providing care. In addition to that, we want to build partnerships and collaboration because we cannot do this work alone. We absolutely cannot. And that the essence of public health is building these partnerships, collaborating with one another, and building trust. And I would hope that we go back to the table, sit back, and really try to weigh and to the agreements that what they should be providing. And definitely they need to be, right now they're at a stage, they used to call it the startup phase. They're at a phase that they should be providing services for our population. But also we need to be very cognizant of the pandemic and how it really had a lot of setback on this organization as a whole. In addition, the leadership, they're still in a vital, we don't know who their dean is. So there's a lot of moving parts to this item. And one, as a board member, I can only speak for myself. I want to reiterate our commitment to working with the medical school, and they provide valuable services. We heard it directly from community care, that half of their providers are directly from appointed. I don't know if they're paid or not paid by the medical school, but they are. They increased residency training. They're able to provide and draw in CPRIT money as it was outlined to us this evening. So I would hope that we build a collegial relationship back forward to the table. Let's work through things with the commitment that we should and must be providing care to our most vulnerable community here. Thank you.
Thank you, Manager Musaki. Any other, Manager Matani?
I think the language in version 2 really strikes a balance. I totally appreciate. Obviously, Manager Valadez, are your thoughts, and I think that that this language definitely demonstrates a change in direction without necessarily burning anything to the ground. I mean, like Manager Musaitis has just said, there are benefits. And this, Chair Bell, and Mr. Giesler and Mike have shared. I think there's so much upside to having an opportunity to having a relationship if we're able to get there, that where it's based upon sort of agreed upon standards of services. And I think this strikes a balance, and then of course it is a philosophical document too. So I appreciate where it is right now. Thanks.
Thank you, Manager Motwani. Any other comments? Quick.
Very fast. I'm speaking as an adult and a member of this board, and I expect the University of Texas Medical School to be adults and professionals in how they treat us. We're equals in this relationship, that we will grow. And as I expect for it to grow, as I told the UT team that was here and in their presentation, but as such, and in a business and professional world, you give somebody money, you expect for them to be able to allow you to see how that money is spent. It's very simple. It has nothing to do with anything else, not burning any bridges, not doing anything else. We're professionals. We're professionals in the healthcare world, and we specifically are the ones that are targeted in addressing the needs of the indigent and the underinsured, not the University of Texas. That their job is to deal with population health. That's everybody. But we deal with the indigent. And if they can't tell us how they're spending their money on our population, then we have an unequal relationship. And all I'm trying to do is make sure that we have the opportunity to equalize and balance that relationship, but we also need a check as opposed to just a balance. We need a check, and I want to make sure that we put that in place. That's all. Thank you.
Thank you, Manager Valadez. Manager Zuniga.
Just wanted to say that it seems to me to be over the top. We're in a relationship with them. We had the contract with them. They're brand new. They want to work with us. It seems to be too much.
Thank you, Manager Zuniga. Any further comments? Manager Jones.
Information though. So if we vote on this amendment, is there a conflict of interest here as board members who are affiliated with or connected with either the Dell Medical School or UT? Because since this is a UT matter, I'm just asking.
I can't answer that in a board meeting. We'd have to go into closed session. That's a personal, potential, possibly even criminal matter. I'm not going to answer that in an open meeting.
Okay. Any other comments or questions? Did you raise your hand? No. Okay. Any other comments or questions? Okay. I have a motion on the floor and I have a second. All in favor of the amendment, version 2? I have Manager Zamora, Manager Bell, Manager Brinson, Manager Musaitif, Manager Motwani. All voting yes. Any opposed? I have no opposed votes. Any abstaining? I have Manager Jones, I have Manager Zuniga, and Manager Greenberg, and Manager Valadez abstaining.
Yes.
I'm sorry?
No. No, somebody just spoke.
No. Okay. So all of the aye votes, the motion carries. All right. I recognize Manager Motwani for a motion.
I move that the board adopt the budget resolution as amended with staff incorporating amendments as appropriate to the structure of the resolution.
Do I have a second? I have a motion from Manager Motwani. I have a second from Manager Brinson. Any further discussion? Hearing none, all in favor? Any opposed? Any abstaining? I have 2 abstentions from Manager Valadez and Manager Jones. The motion carries. Thank you, members. Members, as with the tax setting resolution, Brianna Yanis will be contacting each of you to obtain your signature on the budget resolution prior to its presentation to the Travis County Commissioners. The amendments will be added in where appropriate to be able to outline our intent. Okay, agenda item number 4, receive an update on Sendero Health Plan's financials and proposed business strategies. Agenda item number 5, receive and discuss updates on the 1115 Medicaid waiver delivery system reform incentive payments, DSRIP, DSRIP program and associated projects, the Community Care Collaborative and other healthcare delivery partners, programs, projects, and arrangements, including agreements with Ascension, Texas and the University of Texas at Austin. Members, I announce that the board is convening in closed session to discuss agenda item number 4 under Texas Government Code, section 551.085, Governing Board of Certain Providers of Healthcare Services, and agenda item 5 under the Texas Government Code, section 551.071, Consultation with Attorney. Are we good, Mike? All right. Thank you, members, for your indulgence on a long evening. Agenda item, we have come out of closed session. It is 9:18. There was no motions necessary for agenda item 4 and 5. Agenda item 6, confirm the next regular board meeting date, time, and location. Managers, our next Central Health Board of Managers meeting is tentatively scheduled for next Wednesday, October 26, 2022.
It's not next Wednesday.
All right. For Wednesday, I thought that was really strange to say next Wednesday. All right, so for Wednesday, October 26, 2022, at 5 p.m. at Central Health Administrative Offices, 1111 East Cesar Chavez Street, Austin, Texas, 78702. Manager Greenberg?
Move adjournment.
I have a motion from Manager Greenberg. I have a second from Manager Valadez. Any discussion? All in favor?
Aye.
Any opposed? Any abstaining? We are adjourned. Thank you very much.
Thank you. You still have to go to the office?